Good morning, everyone. I'm calling this hearing to order. For the record, my name is Kendra Lara, District 6 City Councilor, and I'm the chair of the Boston City Council's Committee on Housing and Community Development. I'm joined this morning by my colleague, City Council President Ed Flynn of District 2. This hearing is being recorded. It's being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. Today's hearing is on docket number 0249 in order for a hearing to discuss the impact of inequitable housing code enforcement and Boston's proactive rental inspection program. Written comments may be sent to the committee email at ccc.ep, is that correct? At boston.gov, and will be made a part of the record and available to all councilors. We'll be taking public testimony at the end of today's hearing. If you're here with us in the chamber, please sign up in a sheet near the chamber entrance. And if you are interested in testifying virtually, please email Megan Kavanaugh at Megan, MEGHAN Kavanaugh, KAVANAGH at boston.gov for the link. For all testimony, please state your name and neighborhood or affiliation and try to keep your comments to 2 minutes. Joining us today from the Mayor's Administration, we have Sean Lydon, the Commissioner for Inspectional Services Department, Sheila Dillon, Chief of Housing, Paul Williams, Assistant Commissioner of Housing Division of Inspectional Services Department, and Leon Bethune of the Boston Public Health Commission, the Director of the Bureau of Community Initiatives. Also joining us today for our community panel, Liz Samuels, the Associate Professor in Residence at UCLA Emergency Medicine at the Geffen School of Medicine at UCLA. Adam Haber, I should have asked you, that's correct? Haber. Adam Haber, Assistant Professor for the Harvard T.H. Chan School of Public Health at Harvard University. Evan Lemire, PhD candidate at the Harvard T.H. Chan School of Public Health at Harvard University. And Dwayne Tyndall, the Executive Director of Alternatives for Community and Environment. Before I turn the floor over to our panel, I'd like to acknowledge my council colleagues for any opening comments in order of arrival. President Flynn, you have the floor.
Thank you, Madam Chair, and thank you to the panel for the important work that you're doing, but also thank you to the Mayor Wu's administration that's also here, that's doing important work in leadership as well throughout the city. I don't necessarily have a opening statement other than just reading the hearing order, but the impact the environment has also on respiratory and asthma related issues. I reference that because the neighborhood I represent in Chinatown has one of the highest asthma rates of any neighborhood in Massachusetts. And I was with City Councilor Wu at the time when the United Scientists Union held a press conference in Chinatown, and they highlighted that fact that Chinatown had the highest asthma rate. So I want to continue to work with the Public Health Commission and other city departments on how we can continue to work with the residents on this critical issue. But I also want to acknowledge the important work that our inspectional service department plays in our city. And as we head into the budget that will shortly be released by the mayor, I'm going to be looking closely at what is the increase in inspectional services, because we desperately need more inspectors in the city that are able to effectively do their job. I think they're overstretched, in my opinion, but there's a lot of great work that they do in the city of Boston, but I think they're understaffed, and I want to work closely with my colleagues on the city council to see how we can be more proactive in ensuring that this department that plays a critical role in the city is funded appropriately. Thank you, Madam Chair, for the important work that you're doing, especially on environmental justice issues. Thank you.
Thank you, President Flynn. And thank you for the administration and the members of the community who are here with us today, this morning. This conversation is not new. Renters in our most vulnerable neighborhoods and community-based organizations have really been ringing the alarm about the disproportionate rates of asthma and the role that housing code violations play in increased emergency department visits. If you've lived in any of these neighborhoods, you had to look no farther than your neighbor's home. Mold and poor ventilation in housing units can induce asthma, a leading cause of childhood morbidity, and is greatly exacerbated by poor quality housing. More than 44% of childhood asthma diagnosis risk is attributed to home exposure. There is really an urgent need to strengthen and expand not only code enforcement systems, but also programs like Breathe Easy at Home and the Proactive Rental Inspection Program to protect the health and safety of tenants, and particularly those in our most marginalized communities. No matter your race, class, or income, whether you live in public or private housing, Black and brown people deserve quality, dignified homes. And we have a responsibility here at the city to be more intentional about reducing the health risks of poor quality housing, but also holding landlords and real estate owners accountable to their legal duty, which is to provide healthy and safe housing for tenants. Our conversation today is just the beginning of our office's work to codify a Renters' Bill of Rights and to ensure safe and healthy homes for all. So I want to thank you for the work that you've done on your research, and Dwayne, in the community for decades to really advocate for this issue. I am now going to turn the floor to our community panel. And first up, we have Liz Samuels, the Associate Professor in Residence at UCLA. Liz, you have the floor.
Thank you. Good morning, everyone. Thank you for having us today and hearing our testimony. I'm sorry I can't join you in person, but I appreciate having the opportunity to speak with you all. My name is Dr. Elizabeth Samuels. I'm an Associate Professor of Emergency Medicine at UCLA. But I completed my medical training and a master's degree in public health in Boston at the Tufts University School of Medicine in Chinatown. I've spent most of my time as an emergency physician working just down the road in Providence, Rhode Island at Brown University. As a medical trainee, a resident, and now as an attending physician in Boston, Providence, and in Los Angeles, I regularly treat patients with asthma. Frequency of emergency department visits for asthma can ebb and flow with the change of season, allergies, and respiratory infections, but some asthma visits have nothing to do with season or what is the pollen count, but rather are driven by exposures to asthma triggers within people's homes. Treating physicians know that as long as a person remains in a home with mold, cockroaches, or water damage, the care we provide in the emergency department is merely a temporizing measure. To actually prevent these patients' asthma from worsening and recurrent asthma exacerbations, something must be done about their living environment. So we're very grateful to be able to share some of our work today. Actually, one question I actually don't know. We do have a couple of slides. Do they get shared on your end, or would you like me to share on my screen?
You will be visible here. We have the slides on hand for us, and the people who are watching on Zoom will be able to see the slides on the Zoom.
We haven't been able to advance them. I don't know if we could get Lee to advance the slides. This doesn't seem to be.
I just can't see them, so I don't know
great.
where we are. But I can tell you to advance them, or I can share my screen.
Great, yes. So if you tell us to advance them, but you should be able to see them. So give us 1 second.
Okay.
We can see them here. We just want to make sure that you can also see them.
Oh, beautiful. Now I can see them.
But yes,
this is perfect. This is the perfect slide.
You should just say next slide, and we'll move them forward. Yeah.
Absolutely. Many of you probably know someone with asthma or may experience it yourself. It is an inflammatory disease of the lungs. During an asthma exacerbation, inflammation and swelling narrows airways in the lungs, resulting in partial or full obstruction of the airways, creating difficulty breathing. Asthma attacks are preventable and usually reversible. However, asthma can be deadly. In my own experience, patients with severe asthma are among some of the sickest patients I have ever had the opportunity to care for in the emergency department. Next slide, please. It is estimated there are about 26 million people living with asthma in the United States, 7 million of which are children, and about 3,400 people die each year from asthma. Just advance the next animation, please. Asthma-related illnesses result in over 15 million clinic or outpatient hospital visits annually and nearly 2 million emergency department visits. Being in the hospital or a clinic for asthma exacerbation doesn't just mean that you're sick, but it also means days of missing work or school, with over 14 million lost work days and 10 million lost days of school. Next slide, please. There are multiple factors which lead to the development of asthma and asthma exacerbations. Housing quality is a critical determinant of asthma, particularly for children. Several meta-analyses, which are analyses of other studies, have showed that indoor triggers, particularly mold, are amongst the strongest risk factors for asthma. Other risk factors seen on here that are within the home include pests, mice, rats, cockroaches, dust, and then there's also additional factors which were already highlighted before, such as air pollution and the surrounding environment outside the home. Extensive evidence does suggest that demonstrates that improving housing conditions leads to better respiratory outcomes for people with asthma, as well as reductions in healthcare utilization, asthma exacerbation, missed school, and missed work due to asthma-related illnesses. Next slide, please. While asthma touches all communities, low-income communities and communities of color are disproportionately impacted, not only by increased incidence and prevalence of asthma, but they're also less likely to receive daily medications for asthma, evidence-based standard of care, and they have increased emergency department utilization and higher rates of death. In other words, they have more severe disease. Next slide, please. There is not something about being Black, Native American, or Puerto Rican, or low income, which make people more likely to develop asthma. Rather, it is the conditions in which people are forced to live, specifically environmental exposures in the neighborhoods and homes where they are able to find housing. Structural neighborhood conditions, in combination with physical conditions of people's the homes people rent and reside in, result in differential exposure to asthma triggers and, as a result, inequities in asthma by race and class. Factors leading to asthma inequities include limited access to care, poverty, and environmental allergies in and outside of the home. Ensuring healthy housing is perhaps one of the greatest opportunities we have to improve the health and well-being of our neighbors and broader community. The connection between housing and asthma exacerbations and the improvement in asthma with correction of asthma triggers is well established. Our research has also demonstrated that poor quality public housing, which has failed a home inspection, can be correctly identified by mapping emergency department visits for asthma. Furthermore, these visits rise almost a year before a failed home inspection, underscoring how a resident complaint-driven approach, which is what is currently utilized in most places around the United States, results in delay and under-identification of problematic housing conditions. Delays in identifying and remediating these conditions means more days of illness, worsened individual and community health, and more days of missed school and work, all of which is entirely preventable with expedient identification and remediation of unhealthy housing conditions. Thank you for your time. I'm happy to take any questions if you have them, and Evan or hand over the presentation to Evan to share more about our research examining neighborhood inequities in the correction of identified asthma-related poor housing conditions here in Boston.
Thank you, Professor Samuels. We are going to go to Evan Lemire, and Evan, please introduce yourself for the record, but you're going to be talking about the research, correct?
Of course. Hi, everybody. My name is Evan Lemire. I'm a PhD candidate in Dr. Haber's group, and I'm going to talk a little bit today about the results of the study that we published last year. Could I actually get the next slide, please? Thank you. Okay, so as Dr. Samuels has said, the relationship between poor housing conditions and worse respiratory outcomes is very well documented. Housing quality is a crucial determinant of respiratory health. Last year, we published a study called Unequal Housing Conditions and Code Enforcement Contribute to Asthma Disparities in Boston, Massachusetts in the journal Health Affairs. When we began this study, we wanted to investigate how effective laws actually are in preventing the presence of indoor asthma triggers. We also wanted to ask whether the effectiveness of these protections varied over the geography of the city or by demographics of race and class. All tenant reports to the City of Boston's Inspectional Services Department from 2011 to 2021 were downloaded from the Analyze Boston Open Data Repository. Each report in the dataset records a tenant-requested inspection or case submitted to ISD. These totaled 69,487 reports over that 10-year period. Now, not all of these reports were actually relevant to respiratory health. Many of them had to do with improper clearance of trash or other things like that. So we filtered this data set to those complaints which were relevant to asthma. These complaints included the presence of mold, pest infestations from mice or cockroaches, poor ventilation, or insufficient heat. After this step, we were left with a data set of 25,830 reports over that period. To look more closely at racial demographics and how they relate to the reports of asthma triggers, we also incorporated data from the 2017 US Census. On this slide, we're looking at 3 maps which break down the incidence of asthma-relevant housing complaints, racial demographics, and the prevalence of asthma morbidity in the city of Boston. In all 3 maps, the city is split up by census blocks. In the map on the left, we are mapping the rate of these asthma-relevant housing complaints to ISD. Brighter colors mean more complaints, darker colors mean fewer complaints. As you can see, the greatest concentration of these reports in the city of Boston are in the neighborhoods of Dorchester, Roxbury, and Mattapan. In the map in the middle, we're looking at the proportion of white residents per census block group. Greater intensity in the color map here means a higher proportion of white residents, while lower intensity means a lower proportion. Finally, on the map on the right, we are looking at the prevalence of asthma morbidity in the city of Boston. Here, darker colors mean higher asthma prevalence, and brighter colors mean lower asthma prevalence. Even just the visual association between these maps is quite striking. We see that the areas with the highest concentration of asthma-relevant housing complaints also have the lowest proportion of white residents and the highest proportion of asthma prevalence. Our statistical analysis confirmed this important result and showed that race was the most significant predictor of asthma triggers by census block group after accounting for other important covariates such as median household income. Could we get the next slide, please? Now, the second question we wanted to ask when performing this study had to do with the efficacy of ISD's response to these complaints. The data set from Analyze Boston provided us with a number of fields with which we could assess this question. First, and maybe most obviously, we had the opening and closing time for each case, with which we could measure how long each case stayed open. Now, on the scatter plot on the left of this slide, each dot on this plot represents one census block group. The y-axis measures the median time that a case stays open in that group, and the x-axis measures the proportion of white residents in that census block group. The plot on the right shows the output of our regression analysis and the different covariates that we controlled for, and the estimate of the effects of different covariates on the amount of time that a case stays open. We controlled for a number of important covariates, including median household income, distance to the ISD offices, proportion of renter-occupied housing, among others. What we found was that the response time by ISD was significantly associated with the proportion of white residents in a census block after controlling for these other factors. We found a 17% or 3.5 days slower response time after adjusting for these covariates, comparing the census block groups with the lowest proportion of white residents to those with the highest proportion. Could we get the next slide, please? Now, on the previous slide, we simply calculated the distance in time between the opening and closing of each case, but this data set also included ISD's own assessment of whether a case was overdue or on time. And we found that this measure was also significantly associated with the proportion of white residents in a census block after controlling for other covariates. We found that cases had a 14% higher probability of being marked as overdue in the census block groups with the lowest proportion of white residents compared to those with the highest. Next slide, please. Finally, another field in the data told us whether or not a given complaint was resolved with a satisfactory repair. Once again, we found that the higher the proportion of white residents in a census block, the more likely a case was to be marked as resolved with a repair. We found that there was a 54% lower likelihood of a case being marked with a repair in those census block groups with the lowest proportion of white residents compared to those with the highest. These results taken in total show us, first, that race is a significant predictor of exposure to asthma triggers through substandard housing. They also show us that the ISD's response is measurably different depending on the racial demographics of different areas of the city. Where a municipal government's response is measurably and systematically slower and less effective between neighborhoods and varies by racial demographics, as our results show, government action becomes a contributing factor towards disparities in housing quality and acts as an element of structural racism. To ensure that their actions do not contribute to systemic racism, municipal governments must enact and strengthen enforcement policies to ensure that risk from dangerous housing does not fall predominantly on racialized groups or poor communities. With that, I'm going to hand it over to Dr. Adam Haber to talk about different policy recommendations.
Thank you so much, Evan. Dr. Haber, you have the floor.
Thanks. My name is Adam Haber. I'm Assistant Professor of Computational Biology and Environmental Health at the Harvard T.H. Chan School of Public Health. It's a pleasure to be here today. I'll get into it. So, state law in the form of the Massachusetts State Sanitary Code, and I'm sure that you all know this, 105 CMR 410 has the following purpose, quote, to protect the health, safety, and well-being of the occupants of all housing, and this law deems it illegal for landlords to rent housing which doesn't meet this standard. Within 105 CMR 410, there's a class of serious conditions specified in section 410-750, which are always deemed a threat to public health. This section includes all of the conditions which are reported by tenants in our study, including for insufficient heat, the presence of rodents or roaches, and unremediated mold or chronic dampness, all of which, as we've said, can trigger asthma. So the law says all residents should have equal access to prompt, effective recourse when exposed to housing conditions that damage their health. But our data, as Evan has just presented, show this is not currently the case in Boston. So we can look to the research literature and policies implemented in other cities for guidance in how to improve effectiveness of code enforcement. Next slide. So given the interacting groups involved in provision of safe housing in Boston, there are several ways we could intervene, some of which have been studied or implemented in other jurisdictions. Next slide. First and most obviously, laws to increase accountability for landlords who do not repair outstanding violations are essential. Boston currently has a registry for all rental housing which could be further used to hold landlords accountable. For example, in an eviction action in Maryland, the state Supreme Court ruled that an owner could not evict a tenant before complying with licensing requirements, which meant repairing an outstanding code violation. So the rental registry we currently have could be used to block evictions if code violations are not addressed, which would be a strong increase in accountability for landlords. Financial penalties for violating the sanitary code currently range from $10 to $500. Given some of the lack of efficacy we were observing in the study, it seems clear that the minimum fine could be increased, and I think data could be made available on the use of these fines to ensure that they are being deployed equitably and effectively across the city. Next slide. Second, tenants themselves are a major motive force to fix unhealthy conditions, but they face an uphill battle against far more powerful landlords, which is of course made much worse by social marginalization. So, city interventions which increase tenant leverage to get repairs made are essential to reduce exposure disparities. The most effective leverage a tenant has is to withhold their rent, which is currently technically legal in Massachusetts, but has a somewhat equivocal legal status and typically requires tenants to seek legal advice, which means it is rarely successfully employed to improve conditions. Baltimore, Columbus, Los Angeles, and Detroit all provide city-run escrow mechanisms which improve the ability of tenants to withhold their rent if violations are not quickly addressed. Several studies have also shown that tenants, particularly marginalized tenants, frequently endure dangerous conditions rather than report if they fear an eviction could result. So, interventions that protect tenants from arbitrary or retaliatory evictions, such as just cause eviction protections, right to legal counsel, both would increase tenants' ability to get repairs made to protect their respiratory health. Even when laws do exist against retaliatory evictions, as is the case in Massachusetts, typically tenants represent themselves, so-called pro se, in eviction proceedings, and may not be able to correctly articulate a valid defense of retaliatory eviction and may lose their case, even if they are retaliated against illegally. To prevent this, the city could enable tenants to bring preemptive injunction actions, which would make retaliatory evictions even more difficult. Next slide. Finally, the city itself can step in to improve provision of healthy housing, most obviously by repairing, upgrading, and expanding the availability of high-quality public housing. A recent report estimated that comprehensive repairs to New York City's housing authority units would reduce asthma rates among residents by up to 30%, and there's every reason to believe the same would hold in Boston. In the case of code violations in private housing, if a landlord refuses or cannot afford to make a repair, the city may make it directly. In Los Angeles, the city is authorized to make repairs and then require property owners to reimburse the city. Next, rather than waiting for tenants who, as we've said, may be reluctant to report for fear of retaliation, the city can identify bad conditions proactively. Currently, Boston's inspection program is proactive, but its requirement that every apartment in the city is inspected means inspections are far too infrequent, every 5 years, and too cursory. Private inspectors are allowed to supplement the public inspectors. Dr. Samuels and I, as she mentioned earlier, recently published a study in the Lancet Public Health which showed that buildings with dangerous housing conditions actually have very elevated asthma rates, and that monitoring the emergency department for asthma exacerbations can detect bad conditions up to a year in advance of a failed inspection. This opens the way for a proactive inspection which goes exactly to the right place and can be stringent enough to enforce repairs. Lastly, data transparency is what enabled our study, and further transparency will be essential to ensure outcomes, and particularly equity, both improve across neighborhoods with different racial makeups. Towards this, the city should make outcome data providing all of the metrics we introduce in this study. They should be public and easily accessible, and this would include some of the things we've listed on the slide: the incidence of exposure and reports to ISD, the length of cases and their closure rates, the proportion of cases resulting in a repair, potentially the landlords with the most outstanding reports, and also fine data associated with each outstanding code violation. So with that, I'll conclude. Thanks very much for the opportunity to testify. I'm very excited to see what the city can do to improve asthma outcomes.
Thank you so much. Next up on our community panel is Dwayne Tyndall, who is the Executive Director of Alternatives for Community and Environment. Mr.
Good morning.
You have the floor.
Yes, thank you. At Dwayne Tyndall, Ace, Roxbury. For the past few years, we have focused on air quality on our Breathe campaign, focusing on building emissions and air quality within our neighborhood. For the past 2 years, we worked with Olin College of Engineering, putting air monitoring both in the neighborhood but also inside of homes to collect data on the air quality of our residents inside of their homes. We are in the process of collecting that data, but we have some assumptions what the outcomes will be. As Councilor Flynn talked about ISD and the difficult work that they are doing, and more than likely they are understaffed, we have those concerns also relative to the inspection process. Last week, ACE and other environmental justice organizations across the country, including Puerto Rico, met with high-level EPA staffers, and there are significant resources available for neighborhoods and cities and states to implement environmental programs. The reason why I'm bringing this up is simply because all these great ideas have a cost, and more than likely, the city of Boston, within their budget constraints, may not have the resources to execute those costs. There's a window of opportunity with EPA funding, and maybe we could leverage some of these funding to address some of these issues. I invite councilors and staffers who would like to meet to talk about some of the potential EPA funding and how that could be applied to air quality. We know that what we can't see will injure or kill us. Roxbury has high asthma rate. Roxbury also has high rate of mortality due to COVID, and the relationship between asthma and the seriousness of COVID is directly related. These are lessons learned that we will never forget. So the task in front of us is that we have great ideas. We also have great ideas on lead and the impacts of lead, and that's a whole different conversation. But when we deal with indoor air quality impacts, lead plays a role in the quality of our health. But as we focus on asthma, we have an opportunity and maybe a small window to try to access resources to implement programs and some of these great ideas and policy recommendations that have been put forth here today. So the last thing I will say, let's think big. Let's think in the context of the possibility of doing something major with the resources that we may have at hand relative to federal funding. So thank you. That's all.
Thank you so much, Dwayne, and thank you to all of our panelists for being here for your presentation and for being here with us today. I would like at this moment to acknowledge that we've been joined by Councilor at Large, Julia Mejia. Councilor Mejia, do you have any opening statements? Okay. So we are going to start with our first round of questions, and I'm going to go in order of arrival and then ask my questions last, if that's okay. So President Flynn, you have the floor. Oh, I'm sorry. We've also been joined by my council colleague, Councilor Liz Braden from District 9. President Flynn, you have the floor.
Thank you, Madam Chair. Again, thank you to the panel and to the mayor's administration that's here as well, including Commissioner Lyden and Chief Dillon from the Housing Department. Well, I wanted to start my question with the study you did on asthma itself. And I was listening closely. And I didn't hear you mention Chinatown in that study. Am I missing something?
Chinatown would have been included as it's part of the city of Boston. We didn't single it out. We didn't actually single any specific neighborhood out. It just became immediately clear that there was a link with the percentage of white residents. So yes, it's part of this study. No, we didn't call it out specifically.
So was it part of the study?
Yes.
And what were the results in Chinatown?
You can see from, in this study, we didn't directly measure asthma. We're only measuring the incidence of asthma triggers as reported to ISD. But in one of the maps that Evan presented, it's visually clear that there's a band of high asthma incidence that goes up from Roxbury and includes Chinatown. So it would concur with what you said in your opening statement, that there's a high asthma rate there. But that's data from the CDC and not new data.
At some point, can you provide me the study as it relates to asthma in Chinatown?
Of course.
Did you also include the South End?
Yes, the whole, the boundaries of the city of Boston are included.
What did you notice about the asthma rate in the South End?
Yeah, again, we were not trying to single out individual neighborhoods, but I would expect from looking at this map of the CDC asthma rates that it's somewhat high in the South End and perhaps not quite as high as Roxbury and Dorchester or Mattapan, but it looks to be elevated.
Yeah, as you know, parts of the South End are very similar to Chinatown, very close to the highway system, very close to the Mass Pike, to South Station, train station, bus station, large public housing development as well. One of the issues I've focused on, and maybe it's getting off topic a little bit, but one of the issues I've focused on with my colleagues is pest control, the impact pest control rats and mice have on asthma. Can you explain that a little bit for me?
Sure. So asthma is largely driven by allergic inflammation, and both roaches and mice are strong drivers of allergic inflammation, and they can trigger asthma attacks. They're strongly associated with asthma incidents, particularly in children. So if mice or rat or roach infestations are not quickly remediated, then that's certainly a health risk. From memory, between 10 and 20% of the reports in our study were reports of those specific things, of mice and roaches. And so a lot of what we're concluding in terms of the disparate impact of these triggers across the city applies specifically to those pests.
What else contributes to a high rate of asthma in a particular area, particular neighborhood? What should we be looking for as it relates to why some communities have high asthma rates as it relates to maybe environmental challenges, environmental concerns? What should we be noticing?
Yeah, it's a good question, and I think Liz tried to outline that there are a range of risk factors for asthma. The strongest ones are related to housing quality. There is an exception, which is viral infections are strong risk factors. So upper respiratory tract infections certainly trigger a lot of asthma attacks. But the analysis of the research literature is pretty clear that bad conditions associated with housing are probably the strongest cause of asthma disparities. So if you see changes in asthma rates between different neighborhoods, it's clear from analysis of the research literature that that's associated with bad housing conditions, and some of the risk factors we've talked about, the mice, pests, those types of things. And also it seems clear that there's a component of psychosocial stress associated with presence of bad conditions, and stress can increase allergic inflammation and make asthma more severe.
Okay. I think my...
May I add to that?
Yes, please, go right ahead.
In addition to the factors that Adam outlined, mold, ventilation, general, I would say, both the internal ventilation within the home, but then there are factors. I think maybe what you're getting at are about the factors of the built environment also have a very large impact on development of asthma. That may be related to proximity to roadway. It can also be related to toxins and pollution in the area. But the internal home environment, the things within the home that we can really remediate and control, pests, mold, ventilation, and any type of allergen control within the house itself.
Okay, my final question, and thank you, Madam Chair, for giving me an extra minute. My final question is, and as I highlighted, I like to look at the data, but have you specifically researched public housing developments, residents living in public housing, regardless of where the neighborhood is located, in targeting public housing developments? If you have, tell me what you have seen specifically with that data.
Sure, yeah. So reviewers for our study asked the same question, and it's a good question. So we assigned each of the reports in the ISD data to either public or private housing by comparing it with the assessor's parcel data. So it's relatively straightforward to tell whether a report is coming from public or private housing. And we observed that there was no significant change in the incidence report rate between public and private housing. So these conditions are happening just as much in market rate housing as they are in public housing. And we also included the proportion of housing in each neighborhood, which is public, as a covariate in the model. So we adjusted for it. And we found that none of the disparities that we observed were explained by the proportion of public housing. So it's not the case that all of these reports are coming from a public housing development, and that's what explains it. It's actually a mixture. And basically, we also found that the proportion of public housing in the city is relatively small. It's less than 5% of the rental units or housing units. And so it didn't make a huge impact on our analysis.
Well, I bring that up because, say, for example, Mary Ellen McCormick Public Housing in South Boston. That area is also very close to the MBTA Red Line area, very dense area. The homes are very old. So you're saying that that area of Mary Ellen McCormick housing project would have no difference than another particular area in a more middle-class area of South Boston. Is that accurate?
I think what I was saying is that we didn't see that public housing explained the results of our study. I don't think it's the case that there would be, like, I think what you're describing there would be a difference.
Yeah, I think there would be a difference because the residents in public housing have significant more environmental challenges than others that don't live in public housing for many reasons. But looking at the data, it seems like you would say that there's no difference.
Across the city, that's true. Not on an individual comparison between one project and a nearby middle-class neighborhood. The message I hope that the study comes through is that effective repairs to housing, whether it's publicly or privately owned, will result in better respiratory outcomes.
If I can just add, part of your question is you're saying if you compared public housing to sort of like a middle-class neighborhood or something like that. Part of that is explained in our study because we also control for median household income. So when we're talking about the difference between public and private housing, we're comparing public and private housing on a similar level of income.
May I add something also?
Yes, Dr. Simons.
And this might be of a point of confusion. Public and private housing in the same area, we wouldn't have a difference. So what you're describing are two different areas with differential incomes, as Evan mentioned, they adjusted for income. But it's not about the fact whether the housing itself, who owns it, the quality of the housing, the conditions of the housing. That is what determines, and whether the structural problems are remediated or not remediated, that determined the increased incidence of asthma from that location. So it's not quite the same thing in terms of comparing housing that's either high quality and doing well in private versus public housing. You can have public and private housing, which have poor, unhealthy conditions inside of them.
Thank you, Madam Chair. I probably just disagree with the study. I think there's major differences between public housing and wealthier communities, but just my opinion. Thank you, Madam Chair.
Thank you, President Flynn. And we are going to go up next to Councilor at Large Julia Mejia. Councilor Mejia, you have the floor for questions.
Thank you, Chair, and thank you all for your work. As someone who has asthma and someone who grew up in substandard housing conditions, I can understand the connection. And I'm just curious if you could just talk to me a little bit about whenever there's construction in certain parts of the city, what we tend to see is a rise and an uptick in mice manifestation and things of the sort. And I noticed that particularly in the apartment that I lived in not too long ago, and that triggered my asthma. I saw a need to continue to use the pump a little bit more, and so I'm just curious, as you continue, as you were doing the study, were there any things that you noticed, or did you dive into looking at the impact that development has on asthma rate increases in certain neighborhoods?
Yeah, that's a great question. We didn't specifically look at the role of development. I understand that's anecdotally true. I don't know whether it's been studied that that construction displaces mice and they move into a new area. But it's certainly true that there's a clear link between the presence of mice and mouse allergen and asthma attacks. We have a forthcoming study which shows that in Boston, in this neighborhood, there's a very high incidence of children who are, if you test them for allergen sensitivity, they're sensitive to mice. So it's very clear that mice allergen is one of the things that's driving this asthma rates in these neighborhoods, and particularly Roxbury. But we haven't looked specifically at construction.
So I want to just note that for the record as something that we should probably dive in a little bit deeper as we continue to develop housing for all to remain here in the city of Boston, that we do so with some sort of intentionality of making sure that we're not triggering people. That's not your job, that's going to be for the next panel, but I just want to name it as something that we need to be mindful of as we move forward. The other question that I have, as an at-large city councilor, I come across a lot of constituent cases of families who are living in conditions that are just not fit for. I don't think anyone should be living in the type of environments that I have seen photos of, and some of it is mold, and some of it is just really poor, bad quality. And I'm curious, as you did this report, were there any patterns of specific landlords or problematic people that we need to be mindful of that are driving this sort of environment? Just curious if your research got a glimpse of that.
Yeah, again, it's not something that we specifically looked at. We potentially may follow up on it. The tax assessor records do say, for the most part, who the landlords are, so it is something we could look at. I know in a conversation with ISD a few months ago that they mentioned that they have a list of particularly bad actors who continue to not repair housing. So I know that there is such a list, but it's not something that we looked at in this study.
And then I know we're going to hear from the administration soon, so I'll just keep my questions in regards to this particular study. I am curious if you could just share with us, on a national platform, who are the folks that are getting this right in terms of really getting a handle on addressing this. If you could point to the best of the best, who are we competing with and what do we need to do to get there?
Yeah, it's a great question, and I tried to outline in my presentation some of the other municipalities who have been doing a really good job. I don't think I could point to a specific. I think that urban asthma is a problem basically across the board. It varies a little bit by geography, depending, like the risk factors are different. In the south, there's more mold, things like that. But basically, this is a problem throughout the U.S. I've tried to provide specific aspects of legislation in other cities which should be looked at. For example, in Los Angeles, having a city make a repair if a landlord can't afford it, something like that, or having city-run escrow mechanisms to improve tenants' ability to withhold rent to make sure that conditions are repaired quickly. But yeah, like I said, I don't think there's a particular municipality that's really getting this right. Asthma disparities exist throughout the U.S.
Thank you for that. And one last question, Madam Chair. I think
Yes.
my time is almost
You
up.
have 2 minutes.
Okay, great. Thank you. So I go to a community health center. That's where I get my primary care from, and as well as my daughter. And I'm just curious, what, if any, engagement in terms of data collection and interaction with some of these smaller community-based health organizations have you had any interactions with? Because I know that that is usually where people go to get their needs, and we don't end up in the emergency room unless we can't breathe, right? So for the most part, our maintenance, for those who use community health centers, that's where we get our care from. And I'm just curious what, if any, data or interactions you've had with some of the smaller community health centers in terms of just getting a handle on the rates of asthma attacks in communities that you have identified across the city of Boston.
Maybe Dr. Samuels can answer that question.
For sure.
I think that's a very good and very important point. Most of where care is received is within the primary care center, particularly for people who have chronic conditions like asthma. We haven't yet utilized primary care data to look at asthma incidence and distribution, but it is an area we think would really add a lot of depth of information to help us both identify and understand the impacts of asthma in communities, and also how that is associated with housing. I will say there are a lot of evidence-based, robust interventions and housing quality program supports that are connected to primary care, particularly through FQHCs that do exist as a kind of gold standard models of care from Boston. So that might be working on individual level based asthma control triggers with like a social worker. Those are one type of program that I know is available through some federal qualified health centers. or individual symptom management. But those data in combination with emergency department data, I think in the future could really help create that proactive approach and platform, which Adam talked about at the conclusion of our presentation.
Yeah, thank you. Thank you for that. I just want to just thank you all for your work. I can only imagine for parents who are listening in, and as someone who has asthma, how difficult it is to be concerned and worried about being able to breathe, and the fact that sometimes we're living in homes that can literally kill us is why this report is so important. So I look forward to diving in with the administration to see what we as the council can do to help support. Thank you.
Thank you, Councilor Mejia. At this time, I'd like to acknowledge that we've been joined by City Councilor Kenzie Bach from District 8 and Councilor at Large Ruvzi Louijen. Councilor Bach, do you have any opening statements?
No, thank you, Madam Chair. I think since I came in at the tail end of this panel, I won't pepper them with questions, but I'm really grateful for them being here, and I caught the edge of your presentations from my office, and I'm going to fully review them after this, but I think I'll save questions for now. Thank you, Madam Chair.
Thank you so much, Councilor Bach. Councilor Braden, do you have any opening statements? You have the floor.
Yes, Madam Chair and Councillor Fernandez-Anderson, thank you for sponsoring this hearing, and particularly Councillor Lara, your leadership and advocacy in uplifting housing and environmental justice, especially on how asthma disparities disproportionately impact Boston's Latin and Black communities. Thank you also to Chief Dillon and the Commissioner that we haven't heard from them yet, the administration team, for being here. And I apologise for my lateness this morning, but I really greatly appreciate all the work and advocacy that is happening. My staff have briefed me and caught me up to speed on this. I'm sorry I missed your presentation this morning. I have my questions are really focused more on the administration and how we manage all of this. The one question I just had was, and it's undoubtedly well known that asthma is driven by the exposure to bad living housing conditions. I'm just and exposure to rodents, roaches, mold, etc. And that sadly in our city, the folks who live in those sort of housing conditions tend to be more folks, people of colour. So that's what we're working on to try and fix. I'm just wondering about how you controlled for other environmental factors that may have been other possible drivers of respiratory disease in the general population. I'm thinking about smoking, vaping, working, occupational exposure to solvents, etc. Did you factor in any of that? And not to take away from the fact that there's a huge problem with environmental drivers of asthma in the home situation.
Yeah, good question. One of the things we looked at was the impact of seasonality. We know that asthma goes up in sort of the pollen season and then down again in the winter. And so we modeled that and adjusted for it and found that it basically averaged out over the study period. So that didn't have an impact on our results. We didn't specifically look at social behaviors in this study, things like smoking and vaping, things like that. I will say in our other study that Liz was talking about earlier, we did control for that, and we found that regardless of smoking behavior, we still see that a building with bad housing conditions has a very high asthma rate. So those are, as you said, undoubtedly important, but they don't explain the associations that we're seeing.
That's good.
I would also add really quickly that in this study, we weren't really looking at the association between asthma triggers and asthma prevalence. We were looking at the association between things like racial demographics and the presence of indoor asthma triggers. So in that situation, it's not as relevant to control for other possible asthma triggers because we're not looking at the effect on asthma, we're looking at the effect on this particular set of indoor triggers.
Yeah, that's good to know. Thank you for the clarification. Thank you. I have my other questions for the next round, Madam Chair. Thank you.
Thank you, Councillor Braden. Councillor Louijen, you have the floor for questions and any opening statements.
Thank you. I just, I missed most of your presentation, but want to thank you for your work in this space. As an at-large city councilor and as an attorney who worked in housing court, one of the main calls that I get in my office, which is similar to others, is about housing issues and about unfair housing conditions, and we know that they're most prevalent in our Black and brown neighborhoods. So it's incredibly important that we continue to hold ourselves as electeds accountable and the city accountable to making sure that we are adequately enforcing our code so that people don't have to live in unsanitary conditions. I used to work often in housing court with Ethan Mascoop, who is now an instructor over at BU on the environmental hazards that our young kids especially are living in. When we go in and they face eviction, then we counterclaim with all of the subpar conditions that they've been forced to live under. And so I think that our role here is to think about what we can do as city councilors to get ISD more resources to do the work of ensuring that our families and Black and brown communities are able to live in dignity, because our neighborhoods and where people live should be dignity affirming and should be complementary to one's health, not detrimental. So thank you for the work you're doing and for this conversation. Looking forward to hearing from the administration about the work we can continue to do. So thank you, Madam Chair.
Thank you, Councillor Lejeune. So I'm going to move with my questions now before we see if folks have a second round, and then we'll move to the administration's panel. So thank you all for all of your work and for your partnership and collaboration in clarifying, answering questions, not just here for the council, but for our office. When I saw this report, I reached out, I was like, oh, okay, there's a problem here. And you were incredibly responsive and have been incredibly helpful to our office in understanding kind of what we're looking at. So we're seeing a 3.5-day slower response time in neighborhoods with the highest proportion of people of color. What would you attribute that slow response time to?
Yeah, I think that's a question that would be well posed to the administration.
Okay.
But I think from our point of view, the variable there is the length of time on average between a case being opened and it being closed. So basically, it's taking longer for things to get resolved. Mm-hmm. Why that is, we can only speculate.
Okay. Thank you so much for that. And just to be clear, 14% higher chances of them being marked overdue, right? So we're seeing a 3.5-day slower response time when people are reporting it. And one thing that we know is that people, particularly from vulnerable and marginalized communities, they're already now reporting as often as other people, right? So we know that even the amount of reporting that we're seeing is probably not, it's not painting a clear picture of the issues in these neighborhoods. But from the people who are reporting and feel comfortable enough reporting, we're seeing that there's a 3.5-day slower response time, specifically concentrated in Dorchester, Roxbury, and Mattapan. 14% higher chances of it being marked as overdue. Do you know what overdue is being defined at? I can ask the administration this too, but do you have that information?
No.
It's just marked as overdue in the data?
Yes.
Great, thank you. And a 54% lower likelihood of the case being closed. And I can ask the administration too if closed means resolved, or if just like we did X, Y, and Z.
The variable in the data was corrected. So sometimes cases are closed, but they don't say corrected. And for this, it was we were looking at those subset of cases which had marked as violation corrected.
Got it. So this is not closed, this is corrected.
That's right.
So 54% lower likelihood of the violation being corrected. And from what you shared to your responses to Councillor Flynn's questions earlier, there was not a significant in terms of what you were looking for public housing and private housing.
Right.
Okay. Thank you. Sorry, I just wanted to clarify that. Now let me move on to my other questions. So the proactive rental inspection ordinance passed in 2013, right? And that program requires that owners of all non-exempt units, which the exemptions are basically similar to the home rule petition that we just passed for rent control, in the sense that if you are an owner that lives inside the building. If you have less than 6 units, you're exempt from this. So it requires that all owners of non-exempt units undergo an inspection every 5 years, which I would like to note is the highest year, the lowest frequency of any other city in the country that has this kind of program. And so this ordinance passed in 2013. Your research took place between 2011 and 2021, correct?
Right.
So what impact did you see in your research on the implementation of the rental inspection program?
Yeah, we saw that none of the incidence rates changed after the implementation of the PRIO. So it essentially had no impact, I'm sad to say.
Okay. So the point of the rental inspection program is ultimately to create some process where people have to get their apartments inspected and so on and so forth. You know, part of it is really to ensure that we are providing safe housing for the people in the city of Boston. But in your research, it showed that the rental inspection program actually didn't have any impact on the housing code violations, specifically that are considered asthma triggers, right? So I just want to be specific that this research is looking at housing code violations that are considered to be asthma triggers across the city. And so in responses to things that are asthma triggers, which I think is important, and the reason why I think that's so important is because legally we are required to provide housing, right? And we are breaking the law if the housing that our residents are living in is unhealthy or somehow causing an impact on their health. So we're not in compliance with our state law when we have all of these. And so in these neighborhoods, 50 black and brown neighborhoods in Dorchester, Roxbury, and Mattapan, 54% more likely to be living in units that are not in compliance with the state law of providing healthy housing. Okay. This question is for Dr. Samuels, because I know that you're in emergency department, doctor. Can you talk a little bit about, you know, we have programs like the Breathe Easy program. Can you talk a little bit how we can leverage the emergency department visits to be responsive to this issue, how maybe we can pinpoint some of these housing code violations, and ultimately I would like to hear more about how they interact with each other, what you see in the emergency room, and how that ties back to the housing.
Absolutely. So I can explain a little bit more in detail about the study that Adam and I referenced. We actually did that study in New Haven. We didn't do that study in Boston, although we hope to replicate something similar in Boston. And so, as I talked a little bit about, we do see changes in asthma utilization, both when there's an upper respiratory virus going around or with seasonality and allergens in the air, particularly pollen. But we do see increased utilization from people who are coming related to other environmental exposures, including quality of housing. So the other research we've done, we mapped place of residence of people who were seen in the emergency department for asthma and saw a higher signal in few different neighborhoods in New Haven. And we did focus on public housing in that study because that is the only type of housing in New Haven we had publicly available, some type of metric of housing quality. So that was the HUD inspection scores. So we're able to see whether asthma visits were elevated or correlated with a otherwise objective assessment of the quality of that housing. And what we saw is that emergency department visits from those housing complexes with poor scores increased almost a year before a housing unit had a failed score. So they're really a signal that you can monitor in advance of a home inspection. You could proactively direct inspections at housing units that may be problematic. It is more specific than it is sensitive so far. We have a lot of work to do in terms of figuring out, and Adam can talk a little bit more about the study model. And in regard to the earlier comment, that initial analysis doesn't include primary care information, which would provide more holistic, robust information about asthma incidence and worsening asthma amongst individuals for community health overall. So I do think emergency departments, I mean, we are like we're the canary in the coal mine of public health and in population health. When there are changes, even small changes in community health conditions, we see that in the emergency department. And it really is just a matter of whether we're utilizing those data, which are already available and collected, to direct community-based public health initiatives.
And so you think that there's an opportunity to use emergency department data from community health centers, primary care providers, to remove the onus from the renter to kind of signal either inspection or some sort of, hey, there's, like you said, there something preemptively is happening here in this home. And do you think that there's a possibility for us to be able to go hospital, private hospital, nonprofit hospital, however, community health center to city versus having the renter have to be the one to make a report, which we know that they typically don't?
Absolutely. I think that there is an opportunity to shift the burden of reporting off of the resident. I think that, there are some logistical challenges to getting all of the different data to be in a centralized place, but all hospitals have to report to a Department of Health their daily admissions, transfers, and discharges. I think that there are a lot of complexities in terms of the health IT, but I think it is possible to have a centralized dashboard, if you will, or a way the data could be organized into a dashboard that could be used to identify signals of potentially unhealthy housing and direct home inspections, shifting that burden of reporting off of the resident, and even shifting, I know I'm listening to the kind of how it is if you have a limited workforce of inspectors who are able to do the home inspections, you can increase the frequency of inspections all you want, but if there's not the workforce to do it, it's very challenging to do. One other thing that we noticed actually in this one particular housing complex in New Haven is that the residents did file complaints, but then when the inspectors came, they were only shown better units compared to units that were actually damaged. So, I do think having that more objective data around changes in asthma incidents, which may be or highly likely correlated with changes or deteriorating of housing conditions, can be really helpful overall.
Thank you. I think that that's incredibly helpful because, you've heard a couple of my council colleagues kind of mention Inspectional Services Department because they are understaffed for what we are asking them to do. And so kind of think, what are the rental inspection program has shown to be ineffective, at least in controlling for these kinds of asthma triggers and these kind of violations in rental housing. So I'm also, kind of oscillating between how much energy we put into this thing that, might have minimal return on investment, and how much can we think more about, like you said, preemptively making sure. I have one last question before I go to my council colleagues for their second round of question. So as we've said, inspectional services understaffed. Now, and this is my understanding of the report and of the study from looking at it, so please correct me if I'm wrong. It's my understanding that if low level of workforce or an understaffed inspectional services department, we would see that there would be a similar delay across the city because we just have less people. All things equal, we would say across the board, inspectional services is having a delayed response all across the city because we don't just have enough people. Now they don't have enough people, but for this for this study specifically, it does not. Did you control for that, right? So like an understaffed ISD does not explain this kind of inequity across neighborhood, is my understanding of what's in your report. Is that correct?
That's correct. We wouldn't expect to see a disparity based on the proportion of white residents just because of an understaffed ISD. We'd expect to see sort of equal delays across the city.
Okay. Thank you. I am going to go for a second round of questions from my council colleagues, and I have more questions, but I'll do it in the second round. President Flynn is not with us anymore, so Councilor Mejia, you have the floor for a second round.
Thank you. I have no further questions.
Thank you. Councilor Braden, Bach, and then Legion. Councilor
No
Braden,
further
you have the floor.
questions. No further questions.
Councilor Bach,
Also fine, thank you.
Councilor Legion.
I just have one question with respect to, let me first give you a little bit of background on why I'm asking. My office has been doing a lot of work around absentee landlords and overrun dumpsters in our neighborhoods. And if you track, a lot of it tracks with, our black and brown neighborhoods in Mattapan, Dorchester. You see it in certain areas of Charlestown, East Boston, Hyde Park. And it's neglect. And sometimes what ends up happening is when folks who live in community and neighborhoods are used to systems not responding to them, they are no longer reporting issues and problems to systems, right? So you have people who live in more affluent white neighborhoods reporting and using systems because that they know that they work for them. And we don't see the same thing. Maybe in some situations you see underreporting in neighborhoods where people are like, well, they're not going to listen or do anything anyway. So what is the use in using my time to report an overrun dumpster or to report that there are poor conditions where I live, et cetera, et cetera? Did you or have you seen that anywhere in your research, that sort of apathy that builds as a result of structural neglect rooted oftentimes in discrimination, racism, but feeling that systems aren't built to be responsive to our needs? Did you see that in the data that you collected?
Yeah, so we're only looking at the cases where people do report, so we can't detect that. Other studies have definitely shown what you're saying, and it's very clear that people, marginalized communities, are not reporting conditions, partly because they don't want to interact with the landlord potentially is going to retaliate, or they don't want to interact with police who potentially going to, who knows. So that's clearly the case, but it's not something we were able to detect because we're only looking at reports that do come in.
Mm-hmm. Thank you. Just highlighting that. And I think this is important for us as electeds and for government to know that there may very likely be issues of underreporting even in our communities. So even with the data that you do have, thinking about how we should be more proactive in responding to complaints and issues in certain neighborhoods, knowing that we have government inaction and historical exclusion and lack of response has probably fomented in a lot of neighborhoods and in a lot of spaces that result in people not trusting or not using these systems, which requires us, I think, to be more affirmative and to lean in more and to counteract not only this data, but underreporting as a result of our structural inequity. So thank you.
Thank you so much, Councilor Lujan. And so I have a few questions, and I don't know if Dwayne is still with us. Is Dwayne Tyndall from ACE still here? Because I want to talk about...
I'm still here.
Hey, Dwayne. Thank you so much. So I want to talk about improving code enforcement, right? And so in the presentation, there are three facets. It's increase accountability for landlords, increase leverage for tenants, and increase provision and repair of healthy housing with government. Dwayne, in your work with ACE, can you talk a little bit more about how you would direct us to kind of respond to some of these inequities that we're seeing in this report? Or what work your organization is already doing to move us closer to that?
Well, I think it's kind of branding it as feasibility. This has been a generational issue within our communities. So as one of the counselors said before, the underreporting will be a constant. So, in my mind, it's very important if we could have dropped this in the lap of ISD, then what is the budget changes where they will have more capacity to execute these jobs? One. Two, how do we protect residents for reporting this with the retaliation against landlords in a housing crisis where the main objective is to be housed? So those are like the two major things that we see is enforcement and folks having some protection after they report out some conditions on housing.
Thank you so much, Drain. I really appreciate that. And in terms of improving the court enforcement, here we have increasing accountability for landlords. One of the solutions that was presented is using the rental registry to block evictions if code violations are not addressed. Have you seen that implemented anywhere else?
Yeah, just in Maryland.
So it is implemented in Maryland. Do you have any knowledge of how that works, or we can do our own research, but just wanted to see if by any chance?
I don't think there's a study yet.
Okay.
It's a good thing, would be a good thing to study.
Okay. Thank you so much. And so that's increasing accountability for landlords and stronger penalties for outstanding violations. I think that's obvious in terms of what happens if you don't correct the violations. And Councilor Lujan and Councilor Lujan and Dwayne, Mr. Tyndall, have shared there's underreporting, and so there's also some proactive work that needs to happen there, because this is only going to function for the people who are reporting to ISD. For increasing the leverage of tenants, obviously we have protect tenants from evictions, just cause, right to counsel, because ultimately the lack of these things make it so that people are less likely to report, right? That's a part of it, is that they're worried about retaliation, and that's something that we're hoping to work on with the Tenants' Bill of Rights and with the mayor's work that's already happening at the State House. But on here, you say increase ability and ease of tenants to withhold rent when there are unsafe conditions that are present. And you talked about in your presentation this idea of a municipal run escrow account. Can you talk a little bit more about that model?
Sure. As I mentioned in the presentation, I guess for those who missed it, I believe it's the case that in Massachusetts it's technically legal to withhold your rent if conditions don't meet certain standards.
Yes.
But I think anecdotally, people really need legal advice to actually pull that off. And marginalized people don't have legal advice. There's, like, if you go to housing, I know that you all have been to housing court, the vast majority of tenants are pro se, they're representing themselves. So that avenue is really not available to the people who are, being exposed to these conditions. So in other cities, there's been a mechanism put in place to kind of systematize and institutionalize rent withholding in a way that makes it accessible to everyone. And that would clearly make it a more effective tool for marginalized people, for people from Black communities, Latinx communities, or poor communities to actually be able to use to make sure that a landlord who's not repairing something is under more pressure to actually do so.
Thank you. And this question is for Dr. Samuels. One of the suggestions in terms of increasing provisions and repair for healthy housing for government, which is the longest list, thank you, on here, is to proactive inspections based on increased asthma incidents. And so we just talked about how emergency department visits and information from primary care doctors can really aid in proactive inspection based on increased asthma incidences. Can you talk a little bit about how you envision that happening?
Absolutely. So in the emergency department, we collect data at every emergency department visit. So we know how many people were seen that day with asthma, that month, that year, and we collect a lot of information to direct the healthcare of that individual. Oftentimes, and in some instances, those data are used for population health, particularly for infectious diseases. Like we can see when there's rises in flu, we use it for COVID all the time. I think people got very used to seeing our community COVID rates. A lot of those data are drawn from emergency department visits and hospitalizations, as well as other testing data. We have shown that you can use emergency department visits for asthma exacerbations. So these would be discrete emergency department visits for worsening of asthma, as opposed to new diagnoses or the number of people with asthma in a population. These would be people are having more severe health crises related to their asthma and going to the emergency department for those crises. You can map out place of residence and that is correlated with poor quality housing. So one vision of that we have discussed of how you would use those data to be able to have a proactive system to identify unhealthy housing and direct home inspections would be to consolidate data from multiple health systems, emergency departments, as well as primary care centers, urgent care centers, to be able to look at where visits for whether there are increased visits for asthma exacerbations from particular locations. And you can do this at the building level, although it is much more accurate if it for larger housing complexes to detect a type of signal. So you could foresee a dashboard with like a map that you could have a set threshold of number of visits over which there would look like an increased signal that you would say, it looks like there's a problem in this housing complex. We're seeing increased ED visits for asthma from that building, and we should go send someone out. We should go see what's going on in that house. Did a pipe burst? Is there mold? Is there mice or like a rodent infestation of some type that needs to be remediated? And that would really be removed. Again, the onus would be removed from the resident in terms of filing that complaint that they've seen mold, that they now have mice, that there's now roaches, et cetera, and that they would be able to be a bit more proactive based off of increased ED utilization for asthma exacerbations. Now, ideally, those triggers could be seen before someone even develops an asthma exacerbation related to it, but sometimes people can't see the actual trigger. Who's a resident, maybe a layperson who lives in that home, but someone who is trained in home inspection will be able to identify and then remediate that problem.
Yep. Thank you so much. Thank you all for being here today, to our panelists, to Mr. Tyndall, the Executive Director of ACE, and to Dr. Samuels, Dr. Haber, and Professor, remind me again?
Just Evan Lemire.
Lemire, there you go. I don't want to mispronounce people's last names. Sure. Lemire. Thank you all for being here. We are done with this panel and we are going to move on to the administration. You're happy to stay and listen in, but you're also free to go.
Great.
All right, thank you so much. Okay, we're going to move on to our second panel. From the administration, we have Sean Lydon, the Commissioner for Inspectional Services, Sheila Dillon, the Chief of the Mayor's Office of Housing, Leon Bethune from the Boston Public Health Commission, who is the Director of the Bureau of Community Initiatives, and Paul Williams, the Assistant Commissioner for the Housing Division for ISD. Did I forget somebody? No, Tierney's not coming. Thank you so much, all of you, for being here. That's fine. Yeah, perfect. So Chief Dillon will go first, at the end, last. Beautiful. Thank you all for being here today. So I'm going to turn the floor to our second panel. Do you have a order in which you would like to present already? Commissioner
Councilor, if
first?
possible, please, I'd like to open up with a brief statement.
Absolutely. So Commissioner Lydon, you have the floor, and then you will go in whatever order you've decided. We'll do Chief Dillon last. Commissioner, go ahead.
Thank you very much. Good morning. My name is Sean Lydon, the Commissioner of Inspectional Services Department for the City of Boston. First, I'd like to say thank you very much for accommodating us here and for hearing us. And thank you to the gentleman and the doctor, good doctor, brought attention to this very serious matter, obviously, in the City of Boston. Thank you, Councilor. And thanks for your support in everything we do. I think that everybody basically knows ISD is critical in the inner works of the city, and we run a very, very tight entity as far as what we can do and what we've been trying to do. I'd like to address the article that was published in the Globe of April 22nd, first and foremost. Obviously, an extremely alarming article. And I mean, it caught my attention, even though I was not Commissioner of Inspectional Services at that time. Mm-hmm. It was an eye-opener, to say the least. So what we did, we actually, in ISD, we had the opportunity for an independent research of a fellowship from MIT, a young lady who was she was an intern, fellowship from MIT. Once again, let's take a look at this study and let's see the metrics utilized, and let's see what the response time from ISD in regards to the portrayal of the Inspectional Services Housing Division, which Assistant Commissioner Paul Williams runs right now at the time. And the bar graphs noted on distance from ISD to these certain particular areas. What the study found is the metric detachment that the authors utilized, Hansen and the 311 system, were a source of data that I understand, although different milestones were not factored into this research. In fact, the published article was such an alarming read. We had this fellowship from MIT, once again, do an analysis on the whole study. What the researcher found is that the failure to analyze all of the data with different resultings in the systems portrayed the response times from ISD in this light. After hours of extensive research with thorough and accurate analysis and objective, the study concluded that the analysis was flawed in the portrayal in response to response times from ISD to different parts of the city. This can be forwarded easily to your request. It's very extensive research. The goal of ISD, in conjunction with Boston Public Health and my colleagues throughout ISD, in once again the Boston Public Health and Department of Neighborhood Development, and Chief Dillon, and the City Council, and other resources, is to educate, identify, and help remediate the health hazard. Being a father of 3, with 2 of my children many times to the emergency rooms, I'm well aware of asthma and what it does to kids in particular, well aware. Our focus has to be on goals to educate, resources to help mitigate, and once again, bring the awareness of the long-term effects of mold, particularly, and other hazards within the homes. Enforcement is done through identification from inspectional services, but the enforcement ultimately sometimes has to come from the courts. ISD cannot impose fines without judicial interference. Sometimes it's the lack of awareness of mold throughout the city, and once again, these programs have to come available through education. And a lot of times through these different parts of the city, they're owner-occupied structures. The resources may not be there to. Mold comes in many, many different ways into a house. Obviously, first and foremost, it's moisture. That is the biggest problem with mold, in my understanding. I can be backed up by Leon beside me. Moisture is the biggest culprit as far as the introduction of mold into a household. Many times, the moisture is introduced through either windows, foundations with very costly repairs to remediate the water problem in the first place, the moisture problem in the first place. It's the programs have to be available to individuals throughout these parts of the city to help remediate these problems. Otherwise, it goes to court. And what happens in the court, that's what takes the long time. And the courts are not it's not a 3-day process that might be implicated. Fix this in 3 days. ISD, we'll respond in 3 days. We can't fix it in 3 days. We can identify it with the help of Boston Public Health. We can see there's mold. We don't know what type of mold. We can identify it, and 3-day response time is not a bad time and it's not a matter of throwing more personnel, in my opinion. It's a matter of helping fix the problem. You kill a snake, you cut its head off, and that's what has to be done with problems like this. And I'd like to offer now to my colleague Leon from Boston Public Health.
Thank you so much, Commissioner. Leon, you have the floor. Please introduce yourself for the record.
Good morning, councilors. My name is Leon Bethune, and I'm the director of the Community Initiative Bureau at the Boston Public Health Commission. And today I'm going to highlight our asthma and healthy housing. Quality. You started.
No.
Today I'm here to highlight our asthma and healthy housing work in our Division of Healthy Homes and Community Support, led by Eugene Barrows and Darius Jordan. And also I'll talk about our long history of collaboration with ISD and other agencies, health centers to improve housing qualities for residents of Boston impacted by asthma. The prevention and management of asthma is a critical public health issue and a priority for the Commission. For over 20 years, we've supported all Boston residents impacted by asthma, particularly those disproportionately affected by this disease, children and the elder, Black and brown residents, immigrants, and residents living in public and other affordable housing. Today, what I'll do is I'll also start, I'll talk about our partnership with ISD, and I'll specifically talk about the Breathe Easy program, and also discuss other efforts through our asthma prevention and control program. And then I'll close with updates on data and trends that we're seeing in relation to this disease. Excuse me. The Breathe Easy program at home works to tackle housing inequity for families impacted by asthma. It was launched in 2006. As Dr. Samuels alluded, housing conditions and indoor air quality majority affects asthma control and management. Exposure to asthma has a strong association with asthma severity, and according to the research, 40% of asthma episodes are caused by housing-based triggers, mold, roaches, mice. So to talk about Breathe Easy program. Breathe Easy is a web-based referral system that allows doctors, nurses, or other health professionals to refer their patients with asthma for a home inspection conducted by the Boston Inspectional Service Department. The program works with landlords to ensure that the housing violations are repaired. To date, Breathe Easy has served over 3,000 families and have conducted over 7,000 inspections to make sure common household triggers such as mold, cockroaches, mice, poor ventilation, old and damaged carpets, and other triggers are eliminated in the home. In our partnership, we would make the referrals, between Breathe Easy and our asthma program. We conduct regular trainings. We disseminate critical housing resources to support residents and landlords. Some stats, about 30% of Breathe Easy cases are for clients living in, about 30% of our Breathe Easy cases are clients living in Boston Housing Authority properties. BHA has been a strong partner of Breathe Easy since the program was launched. And through this collaboration, BHA adopted important healthy housing policies to improve asthma and overall health of residents. In 2000, BHA adopted integrated pest management as the only pest control policy through funding and support by the Commission. This is a great step because, as Dr. Sam has alluded, children exposed to cockroach allergens are 3 to 4 more likely to become hospitalized by asthma. In 2012, BHA became the first and largest public housing community in the country to go smoke-free through our collaboration and funding support. In between 2015 and 2016, we also supported various asthma and healthy housing campaigns at BHA in efforts to reduce asthma and improve indoor environments for BHA residents. And as I said, about 25% of Breathe Easy cases are clients whom English is not their primary language. I'm going to talk about some other efforts we've done on asthma. In addition to our Breathe Easy at Home program, the Commission Asthma Prevention and Control addresses asthma through collaboration with various partnerships, including academic research, healthcare institutions, advocacy organizations, businesses, government and groups on policy and program efforts to eliminate inequities. We also make sure that there's also a asthma care coordination and management with all these folks. And so over the past 20 years, we've raised over $20 million in federal funding to develop strong and sustainable public health infrastructure in Boston to prevent asthma and asthma disparity related outcomes. We're intentional and we're focused on allocating resources to the underserved community with the highest asthma rates. One of the things that our asthma program does is we do direct service and we provide free asthma home visits to all residents across the city. We conduct community trainings for community health workers. We also provide education support, low-cost supplies, referrals to reduce environmental asthma triggers in the homes. Through our development, we also developed the Boston Housing Visiting Collaborative, which is a multi-partnership with various community partners, and so we can expand our reach and address asthma coordination more effectively with communities experiencing the highest burden of asthma. So this is like the highest zip codes where there's actually asthma on a day-to-day basis. So this is really has helped our cross referral and case management of our common clients. So to date, the commission has conducted over 20,000 home visits, and we've provided and our partners have provided an additional 8,000 visits, and for a total of over 28,000 home visits delivered to the most common language spoken in Boston, which is Cape Verdean Creole, Portuguese, Spanish, Chinese, Haitian Creole, Vietnamese, and Somali. The other thing we've done is we are working to address asthma home visiting and to provide a workforce capacity with funding from the Massachusetts Department of Public Health. We've provided asthma home visiting training for community health workers, and to date we've trained over 1,000 community health workers. So, I mean, through all these efforts, we've made like some significant stride in reducing asthma rates and unnecessary emergency visits and hospitalization. And so I'm going to cite the latest data analysis we've done from 2017 to 2021, and to the highest in our progress of reducing asthma outcomes in Boston. So I'll talk about emergency room visits and on hospitalization. So with the age-adjusted asthma emergency room visits per 10,000 residents, it was decreased by 52% overall for Boston residents and by 58.5% for Asian residents, 44.9% for Black residents, 56% for Latinx residents, and 57% for white residents. As for asthma emergency department visits, and this is like done on an age-specific rate. So for the age residents of 0 to 17, that's been reduced by 58%, 42% for residents 18 to 44, 49% for residents ages 45 to 60, and 42% for residents ages 65 and over. As for hospitalizations, we've seen a decrease by 63% for overall Boston, 61% for Black residents, 60% for Latinx residents, and 42.1% for white residents. The data for Asian residents for 2021 was suppressed to a small number of hospitalization rates, so we don't have that. As I said, you know, we're seeing huge progress in asthma-related outcomes, and as we collaborate with, you know, our partners, ISD, the health centers, and our community partners, We're trying to make sure that these gains are experienced equitably across the community. Thank you again for giving me the opportunity to testify today. I would be happy to answer any questions you have.
Thank you so much, Mr. Bethune. You have the floor.
Sure. Good morning, councilors. Let me put my glasses on. My name is Paul Williams. I'm the Assistant Commissioner of Housing for Inspectional Services at the Inspectional Services Department. I've been at Inspectional Services for about 4 years. In the last 2 years, I've been the Assistant Commissioner there. Previous to that, I worked in this building in the Budget Office for 12 years as an analyst, and during that time, I was Inspectional Services was one of my principal departments. I want to thank the council for the opportunity to talk about ISD's Housing Division's work with respect to inspections, with respect to inspecting the city's rental housing stock. Our inspections are an indispensable part of keeping renters housed in units that meet the state's sanitary code requirements. And our inspectors are relied on 7 days a week to not only visit and inspect units, but also to reach out to landlords and management companies to address problems as soon as possible. The Housing Division has 3 areas of responsibility. The first is to respond to housing complaints from renters across the city by conducting inspections upon request. Inspections are conducted to assure that units meet the state's sanitary code standards. The second area of responsibility is to carry out the requirements of the city's rental registration ordinance. Our duty here is to manage the yearly registration of all of the city's rental properties and conduct proactive inspections of randomly selected properties across the city on a 5-year schedule. Our third responsibility is to regulate and manage the licensing of short-term rentals in the city. In 2022, the Housing Division conducted more than 20,000 reactive and proactive inspections and re-inspections. We added over 7,000 new units to the city's registration list and re-registered over 82,000 units. We reduced the number of licensed short-term rentals in the city to around 800 units now, which is well below what existed before the pandemic. Our housing staff consists of 41 positions, 28 inspectors, 2 principal inspectors, 5 clerks, 1 secretary, 4 managers, and myself as the assistant commissioner. 76% of our staff are people of color, 8 of whom are Latinx or Asian, and many who have had decades of experience working in the department. The inspection process, key to our work, of course, is the reactive inspection process. ISD receives inspection requests through 311 requests, direct phone calls to our call center, and emails through the city's website. All of these requests trigger the creation of an inspection case. Initial inspections are scheduled by our department clerks. After the initial inspections, re-inspections are managed by inspectors themselves or department managers. Inspectors are encouraged to work their cases to get the quickest resolution. This often means direct conversations with landlords and property managers. If improvements aren't made in a reasonable amount of time, cases are referred to the legal department for prosecution. Before I close my remarks, I just want to say that when we heard about this study and saw the study, we ourselves were alarmed, not only by what was said, but primarily the connection that was made between our enforcement and the prevalence of asthma in the city. And we were really concerned and took a close look at the study in fact, called the researchers and had a conversation with them. The outcome of that conversation wasn't so much to sort of debate the study, but to say, okay, how do we move forward? That said, we had serious concerns with the study. We had serious concerns with some of the assumptions that were made in the study, methodology, and so forth. I'll give some background. Before joining the city, I actually worked at the Federal Reserve in community affairs, which is part of the research department there. So I have some background in research, along with a graduate degree from the Kennedy School in public policy. I looked at this study, and there are some real problems with this study. We can talk about them, but I think my biggest problem with the study is the term response. Okay? Response usually means when the time it takes for you to respond to a problem. Someone calls you, and then how long does it take for you to respond to a problem? That's not what response means, though, in this study. In this study, response is the case duration. How long it takes between when, particularly for the study, when someone makes a complaint to 311 and when a case is closed. That is not a response. That's a case duration. However, in this study, it's called a response. And so if a case takes a long time, it looks like there was a long response. We can talk about how the department operates, but we'll see that that's a serious flaw in sort of the assumptions of the study and sort of the conclusions it draws about sort of what our department does. And I'll leave it.
Thank you. Chief Dillon, you have the floor.
Thank you. For the record, my name is Sheila Dillon. I'm Chief of Housing for the City of Boston. And while I don't have a direct role in overseeing building conditions or working with our health institutions on building health issues, I have felt that this morning was very informative for me. I was just actually sitting back and reacquainting myself and thinking about building condition and health-related aspects. So it was great. So thank you. I think so much of what we do these days is try to build as much affordable housing for our residents, and then work with our residents to keep them in housing. And sometimes that work eclipses, the connections between health and housing. So I really do appreciate it. It was good for me. It was good for me. Just a couple of comments on what our office is doing on this issue more generally, not so much in an enforcement efforts, but really being more mindful about how our new construction and substantial rehab is done. We have become increasingly sophisticated, increasingly informed on what new construction and substantial rehab should include. And some things that my design staff and the project managers are looking at more intently is making sure that new buildings and substantial rehab is really combating moisture penetration, better foundations, better seams, better flashing, really just looking at water, and especially based on our climate, really looking at water penetration and moisture penetration. We are getting much more educated about the need for good ventilation, but what ventilation should look like, especially in our new buildings, and being very mindful of, while we want to make them airtight and energy efficient, we really do have to have the proper ventilation, otherwise we'll have moisture issues. Very focused on the materials used these days and making sure they're low VOC, and always discouraging or eliminating or not allowing any kind of carpet in our housing. So it is top of mind when we are investing millions of dollars in new housing. We've also, as Leon mentioned, working with the Boston Public Health, Boston Housing Authority on taking down a lot of the very obsolete public housing or renovating it extensively. And I'd be very interested to know more about the correlations between Boston's public housing and the asthma triggers and data, and see, as we plan with the Housing Authority, if we could use some of that data to help our planning and what projects are renovated when. So I thought that would be very, very good data to get and analyze. It is harder when we're working with the private market, and I do believe that ISD is doing a very good job responding to a lot of tenant complaints. We have the Office of Housing Stability, as you know, and residents are coming in every single day, every single week, and saying that they've got condition issues. And we are giving legal advice to them or getting them in touch with Greater Boston Legal Services, et cetera. But it's very tricky. They're very, very scared, especially in a city where there's such a low vacancy rate, and they don't have enough protections that, giving them the right advice on how to deal with condition issues. So I do think that is something that we need to continue to work on. I am very happy that we did pass, thanks to you all, our rent stabilization home rule petition, which would provide and allow Boston to have a just cause eviction ordinance, and would allow us to really make the rental registry more robust, and we would use that also for tracking rents in the city. So I think the home rule petition would provide us resources right now that we don't have. Finally, I jotted down some notes today on things that I heard that I think we could use going forward in making the correlation between housing and asthma. I do think my staff could be looking and working with the researchers here and others on data related to asthma and other health conditions as we plan for our housing activities. One, I really like the idea of an escrow payment program. I think that might be a very good thing, and we're always, it's very tricky working with residents to hold back rent, so maybe if the city had more of its own program, so I'd like to know more about that. And also, it was mentioned that we should be using our REACT scores, and these are scores that the federal government gives, HUD offices give to our very large subsidized properties, and use the REACT scores and see if there's correlations in Boston between the REACT scores that the feds are giving us and housing conditions and some of the health triggers. So maybe we could use the REACT scores also as we plan and how we're going to spend our preservation funding. So I think there are things I learned today, so I want to thank you for that and hand it back to you.
Thank you so much, Chief Dillon. And so I am going to start off with a first round of questions in the order of arrival, and this time I'm actually going to go first. Now, Mr. Williams and Commissioner Leiden, you've both referenced this research, and Commissioner Leiden, you've referenced specifically that a fellow from MIT has reviewed this research?
Yes, that is correct.
And has found that this research is incorrect.
Basically, that it's unreliable. It's used unreliable sources to come up with the data in the portrayal of particularly response time as far as ISD goes.
Okay. Well, I think that, one, since we're here to have a conversation around, one, the incidents of asthma are not ISD's responsibility. The fact that those exist in housing, it's not your fault that they are there. It's also not, we can talk about how to do communication strategy, how to really show up as government to make it so that people feel more comfortable reporting, right? So that, because you can only respond what comes to you as well. So we can do more work in making sure that people are reporting. But when we're talking about inequitable response times, and whether it be response or time of case, it's a big accusation to make that these numbers are incorrect. So are you telling me that you believe that there is not an inequity, that across the board in the city of Boston, if you go to Black and brown neighborhoods, people are getting the same response time as their counterparts?
That is correct.
Yeah, if I can elaborate.
Yeah.
So the distinction between case duration and response time is important because of how we operate. And I'll say part of our initial issue with the study, and again, I don't want to belabor the issue with the study, but when it first came to us, our first question was, if you're going to do a study, you might want to have a conversation with us about how we operate so you would actually understand what the data is that you're looking at. All right. So the assumption is that a short duration case period is good and a long duration is bad. But that's actually not how we operate. Truth of the matter is, if someone calls us about a problem, we send an inspector out. The inspector looks at the problem and determines how long he or she thinks the problem should take to remediate, and assigns that on our order, on our notification to repair. If it's not done, then we go back out and do another inspection, right? And if it's not done, there's a judgment call. Is the work in process, all right? Is the landlord just not cooperating? We have to make a decision about whether or not we have to send this to court. Because once we send this to court, this is not a short process. So we actually prefer to have our inspectors work the case, right, to get it done, because we're trying to get this thing done. So the assumption that a case is open and it's closed really quickly, that means we did our job. No, we probably wouldn't have done our job if we just closed the case really quickly. We're doing our job if we're working the case, right? The problem with the study is, and not having a conversation with us about how we work, right? It makes it look like if it takes a long time for a case to close, we're not doing our job. But that's really not the way it works. And that was our first problem with the study. It's like, you didn't ask us how we work. So
well, in the study, it references the case being corrected, not closed.
Well, corrected.
If I may, the code is remedial, housing code, building code, the code is remedial. As long as work is moving forward and they're trying to fix the situation, remedy the situation, ISD will work. And Assistant Commissioner Williams has said, much better off keeping it in-house than letting it go to court. Now resources are spent on court from the homeowner. A lot of these, once again, are owner-occupied structures. If we're depleting resources that could be to mediate the problem, spending this time in court, spending the money on defense, say, it's much more effective for ISD to handle the situation and work with the individuals trying to mediate the problem, rather than putting this in court, where now you're going to drag it out years, possibly.
Great. Thank you, Commissioner. I would like to offer either Dr. Haber or Mr. Lemuser, if you want to come right here to the podium and answer any of the questions, or if any of these concerns either alarm you or you want to clarify them. I know that it's unorthodox in terms of a hearing, but I think that given that this document is central to the conversation that we're having here, and is such a big part of your work, Doctor, at heart, right here in the podium right here there's a podium, microphone right here. I think that it's important that you have an opportunity to do that, because as somebody who has a background in public health, who worked at the Boston Public Health Commission doing racial justice and health equity work in the executive office for many years, and as somebody who lives in the city of Boston and has spent any time in the neighborhood, I can tell you that there is absolutely an inequity in how you are. Like, you just have, every single counselor here will say that is absolutely not correct, because we have experience being on the ground. So, outside of whatever your opinions are on the merit of this document specifically, we do have a problem. Doctor, please, you have the floor.
Sure. I guess a lot's been raised. It's difficult to know exactly what to respond to, but to the question of duration versus response. Oh, is this not on?
Closer.
Oh, sorry. To the question of duration versus response. I think I take the point that I forgot your name, that you made, that
Paul Williams.
Paul Williams made, that the difference in time, the time length between a case being open and a case being closed could maybe be called a duration and not a response. That's fair enough. We could maybe have been clearer about that. There is also a flag in the data for a case being marked as overdue, which speaks more directly to a response time. And as we presented earlier, that overdue flag is also different. And it's different in a consistent way to the cases having a longer duration. So our interpretation of that data was that the cases both drag on for longer and are more likely to be overdue, which is a question of response time.
that was the most immediate sort of rebuttal I wanted to make. I'm also curious if there is more data. We talked about this in our conversation. If there's more data that wasn't public, we would love to have it be public so that we can analyze it. But certainly the question is, if the data that was made public isn't representative of the last 10 years, then I'm not sure why that would be. But from the data that was made public, we're happy to share our code. The results are very clear.
Thank you so much, Doctor. And so given that we don't have anything presented to us on the contrary, and that, if I'm correct, this is a peer-reviewed study that has been made public, then we are going to continue having this hearing as if the data that is presented to us is true. So now I will move on to my questions. I would like to know, please, what happens, because I do have questions about how you function. Can you share what happens when a tenant complaint, from beginning to end, when a tenant complaint or request for inspection comes into ISD? What's your process? How do you prioritize it? Is it the same process for rental units, Section 8, BHA? Can you just tell me, from the moment that somebody calls ISD, what is the process that it goes through internally in your office?
Well, as I mentioned, cases come in one of three ways, either 311, phone calls, or emails. We don't triage cases in any way beyond we've gotten a call, we need to schedule it. At the point where you call, we schedule.
Right. And you usually schedule an ISD inspector?
We schedule an ISD.
And are ISD inspectors assigned by neighborhood or a district? How are you? Did you say 21 people?
We have 28 inspectors.
28?
Well, we have 28 inspections. We currently have some vacancies, but we have 28 inspector positions.
That is not nearly enough for the entire city.
And so what we do is we simply assign it based on what the ward is. And currently we have, we've broken up these are 22 wards, but we have ward teams. So we don't just have one inspector per ward.
Okay.
We'll have, say, Ward 3, 4, and 5 together, and we'll have 3 inspectors that work that ward. That way, if someone's out that day, we can have someone cover. We schedule based on availability and so forth. So it gives us a lot more flexibility to have teams of inspectors rather than have a single inspector per ward. We ask tenants, do they prefer an AM or a PM visit, because we're trying to accommodate their schedules as best as possible. And depending on availability of inspectors, we try to get inspectors out immediately. Certain things we do classify as emergency.
Okay.
Heat complaints are emergency complaints. Those we get out to immediately. Honestly, most of those are best handled on the phone. Someone calls and makes a complaint about about the fact that their heat is out. The quickest thing to do is call the landlord, because we'll ask the tenant, have you spoken to the landlord? And often they'll say no. So that's sort of a tricky thing. So we'll call the landlord, and often the landlord will say, well, I didn't know the heat was out. Can you take care of it? And we'll call you back to make sure it gets fixed. All right? So some things we will handle immediately, because, again, part of what we're trying to do is get it done as quickly as possible. There's no point scheduling a heat emergency for 3 days from now when someone's in the cold. Yeah. So, again, we just try to schedule as quickly as possible, get the inspector out there. As soon as the inspector is there, we inspect with the tenant, by the way. We never inspect with the landlord or the property manager. The tenant calls us, the tenant makes a complaint, we inspect with the tenant. So the tenant's in the position to let us know not only what their particular complaint is, but we can look at the entire apartment to see if there are other code violations. Right? You call us about mice. If we see you don't have window screens, we'll write that up. Your door's broken, we'll write that up. Yep. All right?
So you'll write other violations, even if you're there just looking for whatever they're reporting?
We will write up every single violation that we find. I give a copy. It's a 4-part form. We'll give a copy to the tenant. We'll keep a copy. We'll send a copy to the management company. But also what we're doing, we write up an order that we send out to the landlord by constable. Many of our inspectors are constables, so part of what their job is to do service. And we try to get those services out as quickly as possible so we can get.
How do you decide who's available? You said that based on who's available, how do you decide, outside of the emergencies, I know that the law requires that you respond to those things at a certain amount of time, but how does scheduling work, right? So one, I want to make a formal request as the chair for the ward map. That might be made public. I haven't seen it, but if you just point me in the right direction or send it to me, because I would love to, one, impose the map, and I would like to know the assignments of the team members. I know you have open positions, but if you have 21 people or 28 people, whoever's working there, how the assignments are split between the wards, I would.
Yeah, so interestingly, we used to use a Google Calendar to do this, but one of the things I've tried to do since I've been in the department is to try to get us as computerized as possible. Yes. And even initially built a database myself, but we've recently transitioned this into Hanson. And as of December, all of our work goes into Hanson. All of it's scheduled in Hanson. We have a calendar in Hanson, and so our clerks know which inspectors are assigned to which wards.
And they'll just go see, like, hey, this person has a bunch of appointments, not available. This is so it's basically like a scheduling.
It's a schedule.
So there's not any other beside that.
No, that's
okay. Thank you. That's really helpful. So they're assigned by wards. You have ward teams, Commissioner, or I think Mr. Williams, either one. Can you clarify for me what the penalties are for outstanding violations right now? So you go, there is a landlord who is, I think the what you just outlined in terms of the process, it's like all things being great. Talk to me about you go to the place, you find a violation, the landlord is unresponsive, they're not fixing it, you got to come back multiple times. Can you tell me about what happens there?
Yeah, and I think this is part of misunderstanding. We actually don't have any penalties. We can't write a dollar violation against them. Our recourse is to turn this over to the legal department for them to take it to court.
And when do you decide to do that? What is your?
Well, again, that's a judgment call based on the inspection, whether or not things are getting done. All right?
If I may, the severity of the violation itself, obviously in the emergency, we can swear out, we can have something sworn out, they can go to court almost immediately, be in the next day, or the day after.
Got it. So, okay, so there are two things that I'm noticing here. One, I like that it is a judgment call because, like you said, it's easier to get something fixed if you're kind of like working with the landlord. And I understand now what you're saying in terms of how long a case is open and the duration if you are trying to negotiate to get something fixed. And also some of that could be remedied if there's a process of, still making the judgment call and kind of negotiating, but bringing it to sooner, like reporting them sooner, right? So now I'm getting a picture of where there are some places where it could cause things to look like they're taking longer or not being resolved and so on and so forth. Chief Dillon, earlier on in the COVID-19 pandemic, we implemented an eviction moratorium. Can you talk a little bit more about what enabled the city to take that action legally and otherwise, how we implemented it?
So first, you're correct. First, there was an emergency declaration that that Governor Patrick then took, and that allowed evictions or required, the evictions were not allowed. When that expired, the Boston Public Health Commission had an emergency declaration of their own that because of the pandemic, we didn't want to see our shelters become more crowded, they put forth an emergency declaration that didn't allow evictions. That eventually expired.
And so the city of Boston, as a municipality having the power to prevent evictions, does it require an emergency? That either the Boston Public Health Commission or the city, like you said, they made a statement that this was a public health emergency that did not allow evictions. Is that what is required in order to say you cannot evict this person in the city of Boston outside of the legal system?
Yeah, and it's and I'm not an attorney, so I know there was a lot of debate within the Corporation Council and the Boston Public Health Commission to ensure, to make sure there was standing to actually make that declaration, and they didn't do it lightly because it can be legally challenged, and it was legally challenged, although it stood up for quite some time. But it was my understanding, it was very clear, right? We had a pandemic. We were able to point to the pandemic. We were able to point to people's difficulties in paying rent, the health implications of overcrowding, and so therefore it wasn't easy to make, but you could point to evidence to make it.
Yeah. And the reason why I'm asking is, not because I'm hoping for a declaration of a public health emergency, but because one of the solutions, like I said, this is not on LISD. We have to figure out how to get the issues fixed. Is in terms of how we can increase accountability for landlords. One of the solutions that was presented was blocking eviction if there is an ongoing issue that has not been resolved. And so I'm more so asking the question, thinking about what would enable a city like a municipality to block an eviction, and if it would require their state or local legislation. So I love the programs at the Boston Public Health Commission. I think Breathe Easy is an incredible program, and I think that it's, the way that you directly work with the emergency room departments, but also the primary care providers, is really foundational for this idea that we're thinking, right? If people don't feel comfortable either calling ISD or reporting to their local government, how do we use the increased reporting and asthma triggers to kind of preempt a call to ISD to kind of go and see if there's an asthma trigger in the house? Now, doing great work. You mentioned some of the numbers in terms of the reduction in asthma in the city. Have we seen any reduction in the inequity? Meaning, when you look at the rates of asthma in Black and brown communities and the rates of asthma for predominantly white communities, there is an inequity, meaning that there are higher rates of asthma in Black and brown communities. Has the numbers that you shared were an overall reduction in asthma in the city? Have we seen a reduction in the percentage difference between asthma rates between Black and brown people and white residents in the city of Boston?
Yeah. We have. I'm not going to speak to the numbers because I don't have them. But
I would like them, please.
I can get them for you. Yes, it's done through our research office. So yeah, but I didn't bring the numbers with me. So I want to be clear and accurate, and I don't want to miss.
So, for example, some of the numbers is that, a Black child is 4 times more likely to suffer from asthma or have an emergency room visit due to asthma in the city of Boston. You're saying that has lowered, so now it might be 3 times or 2.5 times.
Right.
So there
right.
has
But
been but you don't know what the numbers are, but we have seen a reduction.
Yeah.
No, I was just wondering, I mean, one thing I wrote down, and I think we should explore, and maybe the Boston Public Health Commission is already doing this, but I'd like to be more involved in it. Can we use the data that's coming from hospitals or health centers? And I know they follow up immediately and get into the apartments or homes, but is there a way that we can use that data to see if there's trends? Are there particular owners? Are there larger affordable housing projects that may be partners of ours that maybe need to work on whatever it is causing the condition? So I think there is something that I'd like to follow up on as we plan and how we use our funding for preservation activities. So it is something that I'd like to follow up on.
Thank you so much, Chief. And I'm going to stop because I have a million other questions and I really want to give time to my council colleagues. Councilor Mejia, you have the floor.
Thank you, Chair. I'll be quick because I have a 12:30. But I would just I have 2 questions. And before I ask, I just want to make a statement. I think it's important as we continue to build trust, right, and work across different city agencies, is that always to come into this chamber with assuming best intentions, right? And I think that sometimes, the data might be conflicting or whatever the case is, but at the end of the day, the bottom line is that we can all agree that we want our residents to be healthy, to be well taken care of, and that the response rate, regardless of whether it's from the moment the case opens to the moment the case closes, that at the end of the day, the goal is to respond to people in an efficient manner, right? And for them to feel like their case matters, right? So I think that we can all just agree on that.
I can assure you, Council, that is ISD's priority.
Yes, and I appreciate that. And so as we continue to kind of go through this process, I think the goal for us is to really understand what we need to do to help support the work, whether that is more training for the inspectors, whether that is more allocating more funds to be able to do more of a thorough analysis. Like, I would like to know and utilize my time with you for you to share with us explicitly what you think you need to be able to be set up for success as it relates to identifying and handling these issues.
I think ultimately is education. Education outreach to property owners on what mold, what the long-term potential hazards are to mold, particularly in children. Is education and then resources available through different city programs from the council and administrative offices, and also programs through Chief Dillon's office. And once again, I think it's the education and what it does and the outreach into the communities where it is affected most.
Can you talk to me a little bit about the training that the inspectors get before they go out? Like, kind of just give me an understanding of the onboarding process and what are the things that you get them to, understand. Kind of, if you can walk me through the onboarding process and also just kind of what that looks like.
Yeah, sure. So we don't hire inspectors in mass very often, so usually what happens is inspectors are hired one at a time and so forth. So there isn't a sort of a formal training regimen that we'd put groups of people through. A lot of our inspectors, as I said, have been there for decades. What we do is first require them to know the state sanitary code. And so the first couple of weeks is nothing more than studying the state sanitary code, reviewing the state being quizzed on the state sanitary code, because that's the basis of their work, right? After that, it's one-on-one training with a principal inspector, where they go out with the principal inspector, view the principal inspector doing that job, and then finally them going out and doing the job with the principal inspector, sort of reviewing their work. And they don't go out and inspectors don't go out on their own until the managers and principal inspectors believe, one, they understand the code, the two, are capable of conducting inspections on their own.
And you mentioned that most of your inspectors have been there for a long period of time. Can you talk to me a little bit about kind of what updates and refreshment and courses, so that we're ensuring that those who have been around for decades are up to the 21st century in terms of meeting the moment? Can you talk to me a little bit about that? Because I think that there is something to be said. If you've been doing a job for a long time, that there's something that you could still learn. So can you just kind of talk to me about the refresher courses that I'm assuming that you provide people?
Yeah, there's a state association of housing inspectors, and they regularly put on courses, and our inspectors go to those. All of our inspectors are certified in lead inspections. The code itself doesn't change very often, and so if you know the code, you know the code. Interestingly, the code recently was updated, and all our inspectors were required to go to training on the updates to the code.
And how many of your inspectors are multilingual? Like, do you have different?
We've got 8 folks who are either multilingual in Spanish, Vietnamese, or Cape Verdean.
And in terms of sanctions and fees, right? I'm just curious about kind of where are we monitoring that, and is there a database or a dashboard that, that exists for landlords who have multiple sanctions, and how are we holding them accountable, and how is that data being shared in a public forum?
Well, I'm not sure. There aren't any fees with respect to the reactive inspection process, so there's no data on that. With respect to sort of keeping track of landlords Basically, we're not in a position to sort of hold someone accountable for some sort of past violation. You have to deal with the violation at the moment, right? And so, like I said, wherever you are in the process with your current violation, if it's not being resolved, it'll go to court.
So the reason why I'm asking around, because it's really about problem solving, right? The reason why we have these hearings is to figure out where are the opportunities, right? So let's say, for instance, you are a chronic absentee landlord, right? That you are not really doing your due diligence to making sure that you're maintaining up to code and you are impacting people in their social, emotional, and physical well-being. Is there a space for us to create a fund that exists that where we would sanction and provide fees to these landlords and then utilize that fund to help support residents who are, going through the eviction process or going through, medical health bills? Like, what opportunities exist for that?
If I may, Counsel, that would take legislative action in order to accommodate that type of monetary imposition onto homeowners, landowners, absentee landlords. But at the same time, through the judicial process, individuals are well known to the court systems who are repeat offenders. And the courts do take into consideration past practice of these people, of these individuals who do not habitually maintain their properties. And they pay the price for it through the court system. And that's our recourse. ISD's recourse is through the court system.
I appreciate that. And one of the reasons why I was really excited about this particular hearing is because I believe that we have a high percentage of renters that live here in the city of Boston, and they don't have a lot of rights. And so our job and where the opportunity I think exists is for how, through whatever legislative process or whatever means necessary, what we can do to ensure that we are protecting our renters and that we are creating the type of infrastructure that supports you in the work that you need to do, but also gets at the reason why we're here today.
Absolutely.
So I'm looking forward to that. Thank you, Chair. That's all for me.
Thank you, Councilor.
Councilor Braden, you have the floor.
I have to leave at 1, so if you don't mind, I'd like to put my questions in the record, and we can have follow-up responses later, if that's okay.
Go ahead.
Thank you. So I really am glad that we're really trying to focus on getting to some remedial actions that will improve the situation. And I know we've had an ongoing conversation with ISD over the last couple of years about how to address chronic offenders in the landlord space who don't keep their places up and don't seem to respond in a timely way to your prompting to improve things. So I was just wondering, in terms of the ordinance, the city ordinance says that an authorised inspector must have demonstrated proficiency in the application of the city code and to satisfactorily complete an ISD certification programme. So I know you're saying that sort of like almost like you come in and you study the code and then you work with an experienced inspector, and then you're sort of let out on your own. That's one. So, and just do we always use ISD inspectors, or do we ever share the responsibilities with other agencies such as BHA or Metro Housing or any of those other agencies? Is a question, and just how that. The other question I had was in terms of just the number of you have 28 inspectors right now. How many vacancies do you have?
I believe currently we have about
4. 4?
About 4. I'd have to look at
4 vacancies. So you're running about 24 inspectors. And then just in terms of how they're allocated by ward, like how do you group the wards? This is something one would have an answer to, but in terms of, do you group the ward? Because there's such changes in population, the wards are 100 years old. So putting them like 3 wards together doesn't necessarily equate with, there's maybe 1 or 2 wards that you might have 5 wards that are equivalent to the population and 2 wards. How do you figure that out?
Yeah, so the wards are based on our history of the amount of inspections per ward, and then we basically sort of put them together. One of the things we have to consider is the amount of drive-in inspectors have to do in terms of doing their job. So we don't want to assign you to a ward over here and a ward over here, and then you're... So we'll put the wards together, but one group may only have 2 wards, another group may actually have 5 wards, based on sort of the history of the number of complaints that we expect from.
Well, that's good to know. So then, you know, we looked at the Analyze Boston hub and looked at violations to the sanitary code, and it reported 2,800 cases that are currently open between 2021 and 23. And does that sound about right for that period of time, the last 2 years? Cases that are currently open?
Yeah, I wouldn't be able to speak to that data.
Yeah, no, that's fine. I don't necessarily expect an answer right now. And then some of the addresses are repeated 5 to 10 times on the same date. Does that mean, what does that mean if there's a violation recorded and it's repeated like 5 times? Is that 5 separate complaints, or is it five different issues that you're trying to address? Why is it recorded multiple times?
Well, I'm not 100% sure what you're referring to, but we do have the case where someone will call and then call again and then call again, and the 311 complaint comes in, and you know what? The 311 person won't say, well, you called already, so I'm not going to take it. You called. Every single one of your call is considered a complaint.
Oftentimes it'd be different 311 dispatchers. That's why it'd be the same individual. It might be an ongoing battle between the tenant and the owner.
And I know we've had a conversation about chronic offenders. Like, what's the best way, to identify the folks to try and keep their feet to the fire, so to speak? That's a terrible analogy, but just in terms of keeping the chronic offenders, there are some persistent landlords, management companies that you're constantly on the radar. What's the best way to tackle that? And again, I'm zipping through my questions, Madam Chair. More importantly, I think we had a conversation. You said here you had a 4-part form, a pen and paper. Is that a pen and paper report? Like you give it's 4 forms, you fill it out, you give a copy to the tenant, the landlord, you have some goes back to the office, and the inspector keeps one. We talked about this, we've been talking about this for a few years, and I was wondering, in this day and age, have we moved any way? We talked about getting better technology for you so that in the field you could record photographs of what you actually see in front of you, and then it would all be put into, just in terms of electronic data. Have you got the equipment and the tools to be able to work with that?
Yeah, so our rental inspection team operates a little differently from our reactive inspection team, and it's sort of a history of sort of how the team came about and how it was funded. I was actually the analyst here when this all came about, and that technology was funded, and it was built into the process of our rental inspections. So rental inspection shows up with basically a cell phone. It does the inspection. By the time that person leaves, that stuff has gone into the system. An email is generated, sent to the landlord, and you get a generated email of your violations. We're just getting to the point of getting the reactive inspections to that point. As I said before I got there, much of the reactive inspections wasn't just done on the 4-part form, but all of the back office stuff was done on paper as well.
Yeah.
We've just eliminated that, and so we want to catch up the reactive team with the rental folks, because the technology is there. There's a fair amount of work that needs to be done with it, sort of do it.
So, the city ordinance establishes that a chronic offender point system, but it seems that we haven't been able to really operationalize that because we're using we don't have we're not using the data system to really make it like the proactive, like the rental registration system seems to work better. Like in terms of the chronic offender, where we really have the pain point in terms of premises that are not up to code, etc., and then to register, to really record a chronic offender point system, it seems like we need to do some work on that particular space. So I know we're going to. This is one little moment in time, and I want to follow up with talking to you folks at ISD about how we could improve that system. And then, a few years ago in 2020, Mayor Walsh had a review of an outside firm, Sullivan and Worcester came in and did a review of practices in the ZBA and in ISD, etc. And one of the recommendations in their report was that to provide dedicated IT support for ISD, inspectional services. And we were just wondering, this is particularly needed in the terms of proactive and proactive housing inspection, but also reactive. That's again back to that question, wondering how much support do you get from Docket, and do you have your own standalone GIS system, or how does all this work together?
Yeah, I remember that report, and previous to my getting there 4 years ago, ISD had one IT person. Basically, his capacity was only enough to run around and make sure that people's computers were working.
Yeah.
That was it. Today, we've got a dedicated team of folks there. Our head of administration and IT, she has 2 analysts, actually 3 analysts, that works on IT projects, and an IT manager and 2 IT sort of tech folks. So I think we have a team of 6 or 7 people now, working specifically on IT at ISD, and that's how we were able to make some of the changes that we've made over the last couple of years. And Kelly, the head of administration and IT, she's actually from Docket, so she's got a great relationship here and knows how to sort of make those connections.
Yeah. Do you utilize the GIS system?
We do.
You do, yeah. Because I understand that they're very short-staffed, and a lot of folks have left in that department or in that particular division. So, I'm really trying to ensure that we have high expectations, and you folks have high expectations of how you do your job professionally. And I just want to make sure that we're giving you the resources so that you can actually execute your mission.
That's appreciated, Council. If you can see, in the last couple of years, it has been historically, we have asked for those resources through technology and support for the technology through the budgetary process.
And then to have data systems that actually talk to each other, which are really, really pushing on the GIS infrastructure in the city across. It's an incredibly powerful tool that we can use across departments to really inform our work and make better, well-informed decisions. So I'm really conscious of my time, and I appreciate, Madam Chair, that you allowed me to offer these questions. I would be happy. We may follow up with further questions, Commissioner Lydon, and we'd love to have a more in-depth conversation about this whole holding our landlords accountable to really address these sanitary code violations going forward, and seeing if we can improve the health of our residents. Thank you.
Absolutely.
Thank you, Madam Chair.
Thank you, Councillor Breeden. Councillor Bott, you have the floor.
Thank you, Madam Chair. I think I'm going to try to mostly ask general systems questions. I might prevail upon you, Commissioner. I have some kind of ticky-tacky district questions, and maybe we could follow up in the near future on those. I guess an observation that I have about this whole system, and it's true, I would say, about just about every bureaucratic system that I know, is that the weak points are often handoffs. And And so I'm interested in ways that you all, especially because we have you all here together, kind of, Commissioner, like how you guys are working on both the handoffs, even within ISD, between like building and housing and environmental, because sometimes we definitely find just as an office that it feels like, if people are lucky enough to have the right inspector go out in the right category the first time, then things start moving. But if it's sort of not in their bailiwick and it has to be, the building folks need to come out or the housing folks need to come out, like sometimes I think for constituents, it can feel like you're repeating yourself again and again, and that can sometimes lead to that sense of like, what's even the point of this? And so things kind of get stuck in neutral, whereas if folks had a navigator for which sub part of ISD they needed to talk to, it would be more effective. But like fundamentally, we want city systems where you don't have to be an expert in our bureaucracies to navigate them. So I'm sort of curious about those internal handoffs. And then specifically with BPHC, it has seemed to us as though like it's great to have BPHC involved, but sometimes when, for instance, there is like a claim about asbestos or something, and it's getting kind of passed off to the BPHC technical expertise, the ISD folks are not able to kind of like reliably follow up on what the timing is likely to be from BPHC. So we as an office end up kind of like in between trying to chase whoever at BPHC is responsible for getting back about that report, and just it doesn't feel like how it should work, frankly. And I say that because it seems to me like a lot of the discrepancies that we're talking about today, I suspect often trace back to like whether somebody is watching these handoffs. And if you happen to, you could hire people who have done a lot of this before, and they would know, you really have to poke the Health Commission at this juncture, or you really need to make sure the right person at ISD is handing this, or you got to get them to really escalate and look at the question of whether this needs to be passed to legal at this point. And I think like although there's always going to need to be a lot of role for discretion, to me it seems like the sort of differential ability of residents to have access to almost like a kind of minder of this process is part of what gives us differential results. So I would love if both on the BPHC and the ISD side, you could talk a little bit about that handoff problem and what the department's doing on it.
Sure. Thank you, Councilman. I'd say as far as ISD, call comes in or email comes in to 311 or the call center in ISD. What happens then, it almost will go out to supervisors across the board. If obviously individuals do not know what entity, be it housing, be it health department, be it the building department, electrical, mechanical, within the department itself is going to handle this particular type of situation. When it goes across to the supervisors, it's expected. And it will, as we can attest to, it will get dispersed through the supervisors to the right supervisor. It's up to that individual to trickle down to get to the right individual, be it no heat, be it building collapsing, be it illegal apartments, smell of gas, short circuits, whatever it is, it does get down. When it goes to the supervisor, not the supervisor's job to disperse and figure out who this is supposed to go to. A lot of times what happens is you see these calls come in or these emails come in, they're looking for a different entity in the city altogether. And we can try and put them in touch with the right individual, right persons, right department, and they say, this is the 5th time I've been here. And it may be the case that we don't have help, we don't have resources. We have an individual, for example, the collapse in the North End. How come it's taken so long? The Department of Environmental Protection has to do with state entities, and it's in process. And it's frustration on behalf of the constituents, but this process and the safety is the first and foremost concern, and follow through. I can guarantee you, if it's coming into ISD through 311, it's getting attention. I can guarantee you that, because it goes throughout the supervisors. And if it doesn't get attention, if it comes in again, it's brought to the supervisor's attention what's happening here. Do we have follow-through with this? A lot of times it's not satisfactory to the individuals because it's not a problem. And once again, the human element comes into play. This owner hasn't seen rent in 3 months, and this renter is trying to get out of paying rent. There's many factors that come into play here.
Can I just say also, in terms of, I think what you're asking, some of the issues that most of the things that come to us sort of are direct. You have a housing issue, housing. A building issue, building. You've got a restaurant issue. Some things are complex. There are a bunch of things together. And so we actually have an I&E team there. It's a sort of a cross-disciplinary team. There's a housing inspector, there's a building inspector. They actually go out to the problem together, right? And they're used to looking at complex problems and deciding, okay, who needs to be involved? Do we need to call public health, all right? I think that team does a really good job at doing that handoff that you're talking about, because it's not like a housing inspector shows up and is like, well, I don't know. The whole team shows up, and if there's something that one of the people on the team can deal with, they will. Otherwise, at least they know the departments well enough to make sure that the handoff. And the I&E team has been around, I think, about 5 years or so. So they do a pretty good job at
And can you speak to how, because I agree, I think the I&E team, when they go out, is fantastic. I think that I'm curious about how the decision gets made in terms of the supervisor cascade you were talking about, Commissioner, like to send out I&E. Because what I would say is, when I&E goes out together, that's great. What we have often seen in my district is that somebody calls in, and this is not, by the way, a blame thing at ISD, it's just someone calls in what sounds like a building issue. You send the building person. The building person shows up and says, oh, this isn't technically building violations, but it kind of looks like there's probably a bunch of housing violations, but I'm not the housing inspector, so I sort of need to pass it off over to housing. And I guess that, and then there's a sub point, this is more of a tangent, but just what we found is in particular, condo buildings where almost all the condos are being rented out seem to be not, like, we're not doing the proactive rental inspection in the same way for them necessarily because they're listed as condo properties. And those seem to be a particular loophole for us in terms of just issues in my district, like buildings they look like they're all condos on the kind of formal docs, but then you show up and they're actually all being rented to people by their respective owners. But I guess I'm just kind of curious about how you guys decide when you send out that sort of coordinated team from the beginning, and then when you don't, how information flows between. Because I think, Commissioner, the problem I've seen is the building person comes, says, oh, this isn't so much my thing, I'm going to send it to the housing person. But the question of, does a bunch of the information that they've picked up along the way get also transferred to the housing person, or does it just go to housing with minimal to and sort of start over from scratch has seemed to be an issue that we've observed.
If it comes in the form of email, then accountability is there. That is the best form of communication, because then individuals are held accountable to that email, and there's no escape. You either did your job or you passed it to the right individual, or you didn't. Phone obviously is much more non-traceable, put it that way, and accountability is there for everybody. I want to focus on the I&E team for a minute. I&E team is made up of resources from 1010, work in conjunction with Boston Police Department, Boston Fire Department, auto repair. They're more of a specialized problem properties, which can identify and prosecute building code, housing code, electrical, mechanical codes, in order to close loopholes on other problems within areas within the city, be it drug houses, party houses that have problems with shootings. We try to utilize work in conjunction with Boston Police in particular to focus on other issues within here that gives a little more opportunity to help alleviate the problems within neighborhoods. That's the I&E team's focus, primary focus.
And I wonder, and by the way, this is a shout out to Lisa Coveney, who's been fantastic in Mission Hill, helping us with some of those. She's really wonderful. I wonder if you could speak a little bit to the BPHC sort of test reporting thing, because that's been a place where we've seen sort of we're not going to court on this because we're waiting for the BPHC report to come back, but then figuring out how to track that's been a little bit challenging.
Yeah, I think just to, I remember this was with the asbestos case that happened. So I think ISD went out and their inspector realized it was an asbestos case. So we got it through BPHC, and it was given to our environmental hazard program. And so we sent it. And so what we do is we have a database. We'll assign an inspector, and we'll send that inspector out to go take a look at a problem. I think that particular case was very weird because it was dealing with a bunch of condominium owners, and when we identified the problem, it was getting them all on board to actually fix the issue that was there. And I think that was the issue, because usually those asbestos violations don't take that long. And it was, threatening to go to court until, we got the landlord. Because, and the other thing is too, based on what we found there wasn't a significant imminent health hazard, because if it was, we would have evacuated that whole building. But since it was just isolated, and it was controlled, and it wasn't exposing anyone, we worked with the condo trust to resolve that. But basically, any environmental hazards that come through our office, we triage them within 24 hours, and we try to resolve them within 30 days. So, and we have that feedback loop with the inspection services, especially if the referral came from them, we will close it out with them.
And Councilor Bach, I'm just going to give you one last question because there is a hearing at 2, and I want to make sure.
Oh, sure. Yes, absolutely. Can you guys then just speak to, and maybe I'll follow up on this question of sort of like buildings that look like condo buildings, but then are actually rental buildings, because like I said, I think we found some weirdnesses with that. But in terms of like escalating things to court, we've really appreciated times when we've worked with your department commissioner about times when it's just like clear that that's what needs to happen here. Do you guys have a sort of like routine triage where you look at all of the cases that are kind of like overdue in that sense, like the flag mentioned with the data, and sort of say like, this probably is at the point where it needs to get escalated to court? Like I know that happens when particular folks focus on particular cases, but I'm curious if there's kind of a default triage for figuring out when to escalate through legal.
Individual inspectors, they're responsible for their court reports, and our legal department on the downstairs will ask for court reports when we do put them into court, and then repeated. There's something that brought that inspector out there in the first place. The reminders will be inherently within the system or from the neighborhood, which will trigger the court action, the result in moving forward, going to court. And from that point on, the court actions are revisits per request, per demand of the court itself.
And Madam Chair, I know time is tight, so I would love to put in a request for just a full update, and I'm sure you guys are thinking about this with the ISD budget hearings coming up, but obviously the getting the housing department records onto digital format has been a long-term thing. And I know, and like, it would be great to get an update on where we are on that, not least because I think for a lot of my type of district, we have a lot of major bad actors who have a lot of properties. And so we continue to sort of feel like being able to collate all this good work that your inspectors are doing and really measure, hey, like here are the folks who just are having all these violations and here's where they all are, would really help us also focus some deserved outrage on some of the worst offenders here.
Understood. Thank you.
Thank you, Councilor Bach. Councilor Lujan, you have the floor.
Thank you. I have a question for Commissioner Williams. I believe you stated that last year there were 20,000 inspections done that were both reactive and proactive. Do you have a sense of breakdown between which ones, like what percentage of the calls, which percentage of the inspections were reactive and which were proactive?
Yeah, I looked at the numbers last night, and it's pretty close.
It's a 50-50 break?
Yeah, it's not exactly 50-50, but it's pretty close. And those include re-inspections. Not only, so there are initial inspections, and they count the times you have to go back out and re-inspect properties. We don't do as many re-inspections of the rentals as we do of the initials, because usually there's problems we find aren't that severe on rentals. Frankly.
Excuse me, I'm sorry, I couldn't hear
The problems we find often aren't that severe on the rental. I mean, we're picking apartments at random, so obviously often we're going to pick apartments and go there and it's like, this looks great. Mm-hmm. As opposed to every call we go to on a reactive inspection, there are problems.
Are you strategically, when you're doing the proactive ones, are you specifically targeting certain neighborhoods or areas?
There's sort of a yes and no to that. I think we've avoided targeting neighborhoods, because there's one thing to sort of target a neighborhood and say, yeah, there are problems here, so we want to focus on. And then there's targeting a neighborhood where people think that you're sort of coming after folks sort of unnecessarily. So we're not in the business of targeting neighborhoods, but we are.
Probably verb choice then.
Sure.
I didn't mean it to say like a target as in a bullseye, but are you, when we think about this, we're talking about Black and brown communities, we're talking about the work of equity, we're talking about centralizing folks that have been historically excluded. That's corrective action that we need to take as a city. And when we're doing that corrective action, it requires us to put our time and our resources in those neighborhoods that have been historically ignored, excluded, that face a disproportionate number of health risks, that have a high percentage of renters that unfortunately end up living in squalor or in uninhabitable conditions, or who are disproportionately, in eviction court, raising counterclaims based on these conditions. So that's what I mean.
Yeah, sure. Yeah, our IT department takes care of the selection process.
Yeah.
And from what I understand, that's part of the process. But we are sensitive to the idea of over-focusing or targeting on a neighborhood, because that can cause some real issues.
I would encourage you to think about what it would look like to be more intentional in that work, to be responsive to communities that have an increased number of units where we see our young kids in our communities are being exposed to health risks disproportionately, or where we're seeing an increased number of calls that are calling for our inspectors. Because I think, that's not bad targeting. I think that's good targeting. And I think it's the work that we have to do to make sure that we're efficiently and effectively using city resources.
Yeah, exactly. In a way, I actually agree with you. The way the ordinance was written, I think it was, and as part of the process, I thought it was written sort of overly broad. And the way it's written, we're required to, if an apartment was built a year ago in the Seaport, we're required to look at it as well, right? It's almost a drain of resources, but that's the way the ordinance is written. We're required to look at everything, where, I do agree with your suggestion that maybe we should figure how to focus what we're looking at.
Yeah, and that's my comment there, is that, like, let's figure that out. Let's figure out how to use our resources in a way that is more responsive, that is most responsive to the communities that are most in need. Commissioner Leiden, I just think, and this is for everyone, I just think that the work is so incredibly important that all of you do, and I want to thank you and all the inspectors, because you play a critical role in letting residents and tenants know that it is, like, they don't deserve to live in units that are subject to mold that exposes their children to asthma. And I think so much of this work is about reminding folks of what they do and don't deserve. And inspectors, even in that interaction, you are a government interaction that a renter may have that they don't otherwise have exposure to, and how important it is for inspectors in this work that can often seem so routine, or another call to Mattapan about X, Y, and Z, here I go, that work is so important for our residents to feel seen and heard in this system. And I hope, on the question of training, when we think about how sometimes work that you do every day, you can sort of lose sight of how important it is for us in our touches with residents to remind them that this is not permissible. I think about my own work, and I think Chief Dillon and other folks were talking about trying to encourage folks to believe that they have the right to withhold rent should they not be getting what they are required to get pursuant to their lease. And people don't believe, often for lots of reasons that we don't have the time and space to unpack fully here, that they deserve to have units where the HVAC is working, where they don't have to have asthma, right? Where neighbors and people feel like asthma is part of living in a certain neighborhood. And I just think it's important for us, for inspectors, to really think about what training looks like and what retraining looks like and what implicit bias looks like in the process, so that we don't become numb to the conditions that our residents themselves too often become numb to, because we are not reminding them of what they deserve. And our individual touches, either with housing inspectors or with different agencies, it is our duty and our obligation to remind them what they deserve. And so I thank you for the work that inspectors will do and that ISD does to remind our residents of what they deserve legally and what we want all our neighbors and neighborhoods to look like, that affirm their dignity as individuals and as residents of the city.
Agreed, and I thank you for your accolades, Councilor. And what I'd like to do is invite you down to 1010 Mass Avenue and spend a day, spend a Monday, spend a Friday from 8 o'clock in the morning till 4 o'clock in the afternoon and look at the interface and perhaps go in the field with some of the inspectors. I would say, as Assistant Commissioner Williams said, 78% of 1010 are a minority.
Yeah.
I would venture to say probably 95% of 1010 live in the city of Boston. Yeah. We're a community in 1010, and our outreach, our human touch is prevalent in virtually everything we do. Anything you do, you have what they call bad apples. You have 10%. You have 10% in the military. You have 10% who's not going to do their job. 10%, they're accounted for, and that's a given. That's going to be in any walk of life. I can honestly say that 90% of the individuals who work in 1010, the human touch is considered every single day, and they're there. And I would ask that you come down and visit us and spend a day with us.
I appreciate that, Commissioner. Just as a reminder, I've worked a lot with inspectors as a housing attorney in these neighborhoods of Mattapan, Dorchester, Hyde Park, East Boston, where we had to rely on ISD in order to hold landlords accountable. So I'm not saying this as someone who has not, in fact, I'm saying it as someone who knows how difficult the jobs are of inspectors, and someone who knows that our systems, even when there are Black and brown folks running them, we too are subject to becoming numb to some of these issues. And so I say this with the knowledge that there are people who care in all of our systems, and that we have to do the rework of making sure that we are that we're affirming our residents, and that we are not becoming that we keep high expectations for our residents and for ourselves.
As does management in 1010. We have high expectations.
Yep. And I was with someone yesterday who was singing your praises. So I believe in the work that ISD is doing, and whatever we as a city council can do to further support your work, we are here to do that.
Thank you very much, Councilor. Thank you.
Thank you,
So
Councilor.
I have to say that one thing that these guys I commend with all the work that they do is that the other difficult thing, and I think you guys have mentioned, is like 99% of the landlords that are out there are small landlords with limited resources. And so when you look at the duration of a case and getting things to be fixed, there's that resource issue. And I think we have a little collaboration that we meet once a month, and we're talking about strategies on how to figure out how to close that gap and give the landlord resources, and maybe we'll reach out to Chief Dillon too to see what we can do.
key.
Thank you.
Awesome. Thank you.
One of the solutions that we are exploring to this issue is looking at how the city can support these type of landlords to really make sure that we're giving them the resources that we need, and what does that look like in terms of who is eligible. That is on our list of things. As I've mentioned before, this is not an issue that is an IS,
Right.
it's just not an ISD issue
Right.
to correct. So
'Cause,
there are a number of things that we're doing. And so I want to close us out before we leave, and I want to just bring us back to kind of circle out everything that we've heard. I know that we've had much general conversation just about ISD, the rental inspection program, and how everything works. And I know that Councilor Bach and Councilor Lujan have shared with you, Commissioner, and folks at ISD how important your work is, and so I'm not going to belabor the point. I talked to Commissioner personally. When I've had issues in my district, the Commissioner shows up himself to the meetings. I have had constituents call me, and I have forwarded very high regards and to specific inspectors and specific people at ISD because people have called. And I know that you don't often get a lot of calls with people giving you compliments. And so whenever I get those, I definitely make a point to make sure that the Commissioner gets them. And the Commissioner himself is incredibly responsive, and we have had very little issue in terms of our district. And so the issue that is at hand here is not about whether or not you are committed, and whether or not your inspectors are committed or doing their job. That is the thing with structural racism, is that it's not about individual people. It's about how our policies and our practices make it so that it can exist. So it's not about the fact that your staff is majority people of color. There could be not one white person working at ISD, and structural racism would be there, because it's not about individual people. Nobody thinks that your inspectors are making decisions to take longer to respond to a certain neighborhood and so on and so forth, right? Because like you said, these people come from these neighborhoods. These are people that live there. They understand what these issues are. They know the importance of it. What I am seeing is that there is too much being left to judgment and discretion. And when you leave too much to judgment and discretion, it opens up the space for bias, whether it be implicit or explicit. In the sense that, like Councilor Lujan mentioned, there are specific neighborhoods that need more. And so although you might be saying, hey, we treat everybody the same, that is not the need. The need is not that every neighborhood in the city of Boston be responded to the same, because in these neighborhoods that we're looking at, in Dorchester, Roxbury, and Mattapan, there is, if we're saying that 44% of asthma incidences can be traced back to housing, and then we're seeing that these neighborhoods have higher incidences of asthma triggers inside of the housing, and we're also seeing that these neighborhoods have higher level of asthma, and they also have higher levels of asthma and emergency department visits, then maybe, right, in a sense where your inspectors are making judgment calls about when it's time to bring this to court, we need to think about, hey, in a neighborhood where we have all of those things to be true, and there's also a higher rate of absentee landlords, there's also a higher rate of slumlords, and there's also a higher rate of people who, you know, might not want to be responsive to the kind of people that live in their buildings or in their neighborhood, that you need a different kind of approach, meaning that the solution that I see, for example, when you're talking about this 54% in terms of how long the case is open, it's about how fast these are getting resolved. And there is a policy change that can happen, legislative, either with the city or inside of ISD, that can speed up the process, maybe across the city, maybe in specific neighborhoods where we have vulnerable communities, where we can close that gap in terms of how fast things are getting resolved. Because like you said, like maybe there is work happening, and maybe you're like, hey, the landlord is working on it. And so I think that in collaboration with the city, where your inspectors can identify a landlord who might be taking a slower time to make the changes because they don't have the financial resources, that there's a place where they can go out to the city to get that so they can move that faster. And in the places where people are being unresponsive, or maybe work is moving but it's not moving fast, in particularly vulnerable neighborhoods, that you have a policy or there is legislation that requires that cases are reported to the court faster, so that the courts, because the court system also takes a long time, right? And so there's so many different moving pieces in terms of what we can do, and this is not about whether or not you have an ISD inspector who's like, oh, I got to call in Dorchester, I'm not going to show up. It's about what are the things that we're putting in place to make sure that we're not making way for those kinds of things to happen in our neighborhood. And so I really do look forward to having a conversation, or continuing to have this conversation about solutions. There's a bunch here, and very little of it, I think that this in terms is for ISD. There's talking about the Boston Public Health Commission, right? How do we expand the Breathe Easy program? How do we make sure that that is up to date? How do we make sure that we have resources for small landlords? How do we make sure that ISD has everything that they need, whether it be more inspectors so that people have to wait less time for an inspector, however, whatever that looks like and however it shakes out in terms of making sure that you have the technology during the budget season. I am willing and able to do that because, like Councilor Lujan said, and I think everybody's sentiment here, the focus is our constituents. And so whatever you need, whatever we need to do collectively to make sure that we are correcting the problem, then that is what I am going to give you. And if you tell me to bring the moon down, then I will try my hardest to bring it down to make sure that we fix it. But nonetheless, I am grateful for your work. I'm grateful for your time. I know that you take your job very seriously. And I know that when things like this pop up, it is difficult to not, one, internalize it or take it personal. But I just want to, again, reiterate that this is about the people of the city of Boston. It's about a problem that we're being identified. We can't fix it if we don't say that it's there. So thank you all so much. I really appreciate you. I appreciate you all for all of your hard work and all of the community panelists that were here. And this hearing is adjourned.
Thank you, Councilor.
Thank you.
Thank you.